just in case you were wondering, today's advanced certification training course is on cosmetic applications of photobiomodulation. And the reason why I decided to do a training course on this is that we always get asked questions about using BioFlex for, skin rejuvenation, hair growth, acne, certain skin issues, that kind of thing. And you probably know that Dr. Khan, being a vascular surgeon, focused a lot more on rehabilitation and musculoskeletal and wounds and that kind of thing. But of course, over the years, he had lots of requests for these cosmetic applications. And in fact, we'll be presenting some of his case studies during the course of today's presentation. So there's also been a lot of research put out in the last 5 or 10 years, and I'm going to go over that research as well. So in fact, there is actually really good evidence to use this equipment, to use photobiomodulation for these types of problems, you might say. For some people, it's a problem, other people maybe not. But I think in general, people want to look and feel healthy, and part of that is their appearance. So it makes sense that if you can do something that's non-invasive and is effective, then why not, right? So anyway, that will be today's topic. And I really want to thank Dr. Ben Ewan in Halifax that is joining us today to speak. And it's really fascinating because Ben always does an amazing job when he lectures, and he always chooses topics that I wouldn't necessarily initially think about. And then you realize that, wow, it has a huge impact. And in particular, he's going to talk about the gut being the mirror, skin is a mirror of your gut, essentially, which is that gut skin axis that I think a lot of people are aware about, but Ben is going to really go into depth about that and how it can help with respect to even treating the GI tract and your skin, and some case studies, I believe, as well. So that should be very fascinating. Today's seminar will be recorded, and just in case you're having problems or issues or whatever, you will be sent out an email with the recorded version to watch whenever you'd like. There is no test after today's ACT. You'll be receiving, if you attend, a certificate of attendance for that, and that will go out next week as well. Also joining us, of course, is Dr. Slava Kim, our clinic director, and he's going to focus more on dermatological applications. While some people may not consider these cosmetic, but in essence, they blend in, because things like acne or even eczema, that kind of thing, well, you may see a dermatologist about it, but sometimes they're kind of branched in the dermatological world. But for a lot of people, these are cosmetic issues that need to be addressed as well. And we've treated many of those over the years. So Slava will be presenting a fair amount of case studies on those, and specifically protocol development for that, which is, I'm sure, why a lot of you are tuning in today. Okay, I'll be talking a bit about skin rejuvenation and acne, especially some of the research, some of the protocols and how you might approach skin rejuvenation. And I'll also be talking about hair loss, scar tissue healing. And actually, I will comment and talk a little bit about weight reduction or fat loss using photobiomodulation, because I do get asked about that a lot. And there is some research, but we need to clearly understand what that research means and how you might even use BioFlex if you want to do that as well too. So really, today's topics will focus everything from the gut and the microbiome and how it affects the skin health, to skin rejuvenation and acne treatment, dermatological, scar tissue, keloids and hypertrophic scars, weight loss, and hair loss. Okay, so I'm now going to introduce our first speaker, Dr. Ben Ewan. I think many of you that have listened to some of our advanced trainings or master classes know Ben very well. He's a well-experienced chiropractor, I might say, and he's based in Halifax. Been practicing for over 3 decades, I do believe. He can correct me if I'm wrong on that. And he graduated from Bournemouth in the UK at the Anglo-European College of Chiropractic, also has a master's, and has lectured extensively throughout the world, really. He's a great educator. I always love to have him speaking because he's obviously well received and very knowledgeable. Has a very busy practice in Halifax and has a huge photobiomodulation laser therapy portion to his practice. He's really considered one of the leading experts in photobiomodulation therapy in the world by clinicians. So I'm going to ask right now, Dr. Ewan, if he doesn't mind to turn on his video so we can see him. And I'll ask him to share his screen.
Morning, everybody, especially those of you that are from the West Coast. I hope that you have a nice sleep. And if you're wearing pajamas, make sure that you're all in one piece, please. Make sure that the bottom is on, okay? Or if not, then turn off your camera for the time being. All right, okay, let's get started.
That's very good advice. Thank you.
All right. Okay, now we're going to talk a little bit about skin and how they connected with the gut. And now skin situation there is a pretty interesting and complex composition right now. I listed out 9 different topics that we're going to cover, and I'm going to try to make it sweet and short so that we can have a good understanding of what's going on in the whole idea. And now, as far as skin is concerned, we all know that it is one of the 2 largest organs in the body. However, skin situation is something that is much more interested to the cosmetic industry, because after all, it's about a $20 billion business every year, right? And to the healthcare profession is not as, shall we say, attention grabbing. We do know that it is important, but we're very often is pretty low in the totem pole. So this morning, we're going to have a look at a little bit more about the skin and the connection of the skin together with the rest of the system of our body. In the past 15 years, we noticed that there is definitely an increasing evidence that what is happening in the bacterial flora in the gut has a lot to do with the healthiness of our skin. So let's take a look, because skin is a very complex situation, and at the same time, it's a very dynamic system that we didn't realize that it is, because I mean, we think of dynamic systems such as the cardiovascular, such as the digestive system, or that the immune system. But skin is something that is on our body that doesn't move much. So we don't really pay a lot of attention to it and never quite thought of it as a dynamic system. But indeed, it is quite important. So let's have a look at what is on our skin and also what is in our skin, okay? There's a whole lot of things that is on our skin. Now, they call the bacteria and the viruses and all the living organism that is on our skin under the topic of microbiome. Well, now we realize that the microbiome, so-called, is extremely important to maintain the balance and homeostasis of the skin function itself, okay? And when we talk about balance, we're talking about the number of colonies of these micro, as well as the number within the colony and how they interact with each other so that we can achieve homeostasis in that area there. Now, here's some interesting facts about skin. We have a total skin area on the average person of about 270 square feet. That's quite a bit of skin, And of course, some of us are more thick-skinned than others, right? And now there's about 10 to the 12th power of microbial cells within the skin, all right? Now, the gut has some even more. We have 323 square feet of interfaces within the gut, and it has a 10 to the power 14 microbial cells within the system. So you can see the 2 are extremely busy as well as huge in numbers, okay? Now, the common thing between the 2 is that both skin and gut have epithelial surfaces. And these 2 epithelial surfaces are the largest within the body. And they constantly interact with the microbes as well as the immune system, all right? Now, I put a little small footnote at the bottom, and this is from an American study, is that about 60 tons of food is estimated to pass through the gut in one's lifetime. Now, the interesting thing with that be is that does that explain why there is so much obesity problem in America? 60 tons of food is a lot of food, you know. Now, as far as defense is concerned, the skin really relied on a couple of things. Epithelial layer, which is on the top, the keratin layer, which is a very active layer that do a lot of things that is not visible to our eyes. And of course, there's the mucosa level in that area. And together, they provide more or less a mechanical defense in their system. And the micro that is on the skin and in the skin would provide a chemical barrier to protect us, okay? The skin's acidity is slightly on the acidic side, and it is somewhat inhospitable to a lot of bacteria, but not really a very effective defense. Now, let's have a look at what is actually in our skin and on our skin. Of course, we have a huge amount of viruses that are on our skin that not many people talk about, because we often talk about bacteria, but we don't talk about viruses as much, okay? And you can see that the viruses are the little blue little dots, and that is on the pictures on the skin surface, as well as at the slightly deeper epithelial layer and into the sweat gland and into the sebaceous gland as well too, all right? Now we've seen the bacterium, they're in the little black dots, and they are again distributed quite widely throughout the system, not so much in the sebaceous gland or the sweat gland, but it's certainly on the surface of the skin. And there are a huge amount of fungi that is also present on our skin and a little bit deeper in the layer as well too, which is quite surprising to a lot of people. We didn't think much about fungi. And then, of course, there's a little creature called the mice that's living on our skin as well, too. Well, actually, to be correct, they're actually living in our skin, okay? And this is the famous creature that live in our skin, Demodox follicularum. Now, this looks like something like an alien, you know? And this stuff lives in the hair follicle. And believe me, everybody has them, okay? And it's not just a few, no. In the hundreds, sometimes in the thousands, okay? These things actually live inside your skin. Isn't that nice? They look like some alien from outer space, don't they? With nasty claws and all that. Listen, they are microscopic. You cannot see it with your naked eye, but believe me, they are on your skin and in your skin. Lovely thought, isn't it? Now, this fellow also has a cousin called the Demodox brevis. Now, the two of them, their favorite locations are eyes, the eyelashes area, and the subspacious gland of our eye, the mammalian gland. So they all live there. Okay, it's a lovely thought, isn't it? Right? Okay. Now this picture showed you the hair follicles and the base of the hair follicle. What you see in there at the bottom of the hair follicle are the poops. Okay. Now they come out at night to poop. They don't come out in the daytime. So when you get up in the morning, please wash your eyes, because you got all kinds of poops in that area there. And it is a very bad situation if it's the infestation become out of control, called the blepharitis. And it's a miserable condition, and it's a very, very, very itchy and uncomfortable. Okay, so much for this gross subject. Let's look at something else. All right, now let's look at some of the factors that can actually affect the microbial organism in our skin and on our skin, okay? The first thing we want to look about is gender, age, and size. Now, in general, okay, the bacteria and the microbe that live on a male skin, it's a little different than the one that live on the female skin. Okay, and the number of micro on the male's body is also a little bit higher, but also of a different nature. Okay, and maybe that's why a lot of men stinks, right? The woman smells a lot better. Okay, so now as far as age is concerned, the younger you are, like for example, little toddler, naturally will have a lot less bacterial or microorganism on their skin. But it doesn't mean that as we get older, we get more. It really depends a lot on the lifestyle and where we live. In warmer climate, you tend to have a little bit higher number because it is more favorable for the micro to survive. In colder climate, it's a little bit less, but the difference is not huge, okay? But there is a variation. As far as geographic situations concerned, you would prefer to live in slightly colder climate because it's a little bit less troublesome. However, because of central heating and all that we have, probably is not going to make a huge difference. Now, the immune system that a person has does have a very drastic effect on the number of bacteria, fungi, and viruses that we have in our body. Because if we are immune compromised, it directly affects the micro that are helpful to us as well. And of course, the reverse is also true. And that is, if we are very healthy, the micro is going to be more beneficial and we are able to stand up to a lot more invasion, okay? Now, genetic also has something to do with that because unfortunately, some folks are born with a complete lack of certain micro in their system and it creates a major problem lifelong, which is very difficult. Although now the scientists are looking at different ways to introduce that or sometimes reintroduce that substance and the micro into the system. And so far, the result has been somewhat promising, but it's not 100% just yet. And of course, occupation and personal hygiene also obviously play a very important role in determining exactly how much micro there is in our body, over our skin and on our skin in that area there. Comorbidity as well as other conditions that the person suffers, like COPD, diabetes, and that MS and all that kind of stuff, also affect the amount of micro that are living on our skin and in our skin. So the differences of these things will affect a much more far-reaching effect in the system. And it does affect not just the skin, unfortunately. It also affects a lot of other organs such as the cardiovascular system, the endocrine system, and the neurological system at the same time. But this morning, we're going to concentrate more or less on the skin and the gut in that area. Now, I'd like to introduce to you 4 very common bacteria that is on our skin that has very effective function and has a lot of control and, shall we say, administrative ability to manage our skin. And a lot of the management and stuff like that is really targeted not just on the invader from outside, but also on a very, very familiar residence on our skin, which is the Staphylococcus aureus. And this particular bacteria, shall we say, breeds like a rabbit, and it is easily out of control and is present in every one of us, no exception. And sometimes it can cause a great deal of problem, although it is beneficial to some extent. But the beneficial effects of it is actually less than what harm it can do. For example, flesh-eating diseases or cellulitis are often caused by Staphylococcus aureus. Now, okay, the Staphylococcus aureus remind me, for those of us that are old enough, of this character in Archie Bunker's TV series, Archie Bunker's son-in-law. So those of you who understood, you know what I mean. Now, there is always a bit of a struggle. I call it sometimes check and balance between the bacteria, the fungi, and the viruses on our skin to maintain a certain homeostasis so that nobody is overrunning the situation. The first example, Cutibacterium acnes, and sometimes it's called by its own name, Propionibacterium. This particular fellow has a very useful function because it uses the oil from the sebaceous gland, okay, to produce a somewhat acidic coating over the skin. Okay, we call it acidic film. And this acidic coating tend to ward off a lot of foreign invaders that are actually harmful to us in that area there, okay? And it is quite common, and it is very useful to protect us under a lot of circumstances. At the same time, this particular bacteria also produce another biomolecule called the cocropoprin 3. And this actually help to promote the congregation and the colony survival, as well as multiplication of Staphylococcus aureus, and to produce what we call a biofilm, okay, to both protect the bacteria aureus as well as our skin, okay? So it is a helper to that particular bacteria. Now, there is another fellow called the Staphylococcus londinensis. Now, this guy is a very common resident on our skin. And what this guy does is to produce antimicrobial peptide, or sometimes we call it antibiotics, okay? And that will help to control the overactivity of Staphylococcus aureus, okay? So this guy is a bit of a, shall we say, guard over the aureus to make sure that it doesn't multiply like rabbits in that sense, okay? Now, the next one is Staphylococcus epidermidis. And now this is a very busy guy, okay? And he normally resides on our skin. And the main function of it is to fight the invaders. And it also produces a protein, a protease called ESP. Now, again, this guy also control and keep an eye on the Staphylococcus aureus. And it prevents it from forming too much biofilm to protect itself, so that it can be a bit more vulnerable, and they can control that so that it won't overrun the system. At the same time, this antibiotic that the epidermidis produce also fight other invaders that could come and harm us in that sense, okay? Now, what it also does is that it stimulate, okay, the keratinocytes within our dermis area there to produce antibacterial peptides to either kill or reduce the Staphylococcus aureus. So what it does is that not only it does it himself, it also recruit other cells to fight this situation, because Staphylococcus aureus is just too dangerous if it becomes overpopulated in that sense. However, epidermidis is not only helpful in controlling this aureus, but it also helps to reinforce the tight junction of the skin cell. Now, tight junction is a very, very important element of our skin right underneath the top layer of our skin. And it is responsible for making sure one of the things doesn't escape from our system in large quantity, and that is water. Because if the tight junction is damaged, we will become extremely dehydrated. And this is the reason why burn victims would die if their skin burn beyond 50%, because they're going to lose so much fluid, they literally died of dehydration. Okay, it's a very dangerous situation. So tight junction is a very important element to protect us from invaders as well as keep our health. So what is tight junction? Tight junction is right underneath the stratum corneum, and it is at the, shall we say, at the junction between the top layer and the dermal layer, okay? And if it actually becomes damaged, not only bacteria and microbe will invade into the deeper system of the skin, but a huge amount of fluid will leave the body, okay? And it is monitored by a cell called the Langerhans cell, okay? And this cell is a very busy cell. It's a subset of another cell called the dendritic cell. And it is a very important function that controls and tells the skin and the immune system cells whether we should go into an inflammatory state or whether we should stay quiet. So this guy is an administrator and has a very important function in that area. Epidermis actually help to make sure that the tight junction is reinforced and repaired. So this guide is extremely useful, not just controlling the Staphylococcus aureus, but it's also making sure we are protected at a very important junction. Now, that's not what it does. It also has another function, what I call training function, okay? It goes into the hair follicle on the deeper layer of the skin. And what it does is that it will train and notify the regulatory T cells, which is a killer cell, as you know, to make sure that it doesn't treat the other bacterium or the other microbes on the skin as enemy. So that it will say that, okay, this is friend, the other one is not, that kind of stuff, okay. Regulatory T cells, sometimes it's also known as naive T cell. It's a funny name, but anyway, they have a very important function in helping us not only to keep the skin healthy, but also keep the immune system intact in that area. Okay, now we'll talk a little bit about acne, okay. Acne was thought to be a result of an overgrowth of the acne bacteria, and it causes trouble, especially in teenage years, of course, right? Well, however, what the interesting we found is that the cumulative bacteria acne that causes acne in people doesn't always cause acne in everybody, even though they have the bacteria on their skin. And what happened is that we realized that, well, cumulative bacteria actually have more than one genetic presentation. So that means that they are not all bad guys. Some of them actually are pretty benign. Now, this also happened to be the same situation to a number of microbes that are living on our skin. They are not all identical. So it's like kids in the family. They all come from the same parent, but they're somewhat little different genetic makeup from one to the other, okay? So they can do certain things and they can also not do certain things. So just because you have that bacteria or the virus or the fungi in your system doesn't necessarily mean that you are protected or you'll be damaged, okay? So it all depends on the genetic makeup of that component. Now, eczema is a very common condition, and we know it is another trouble caused by Staphylococcus aureus. And I'll introduce the word dysbiosis. And dysbiosis in the common sense, it basically means that something is out of order, okay? So what happened is that Staphylococcus is extremely aggressive. When it is large in numbers, it will start attacking the tight junction. So it basically attacks its own host, okay? It will break down the tight junction and create leakage of that situation. And when that happens, the immune system of the cell will immediately activate through the T cell, the B cell, as well as the macrophages and the lymphocytes, and they will start to produce chemokine and cytokines. And that create huge amount of inflammation on the skin. And that proliferation create a huge problem. Luckily, we do have another Staphylococcus bacteria that help to control this. It's called hominis. And these guys always keep an eye on the activity of Staphylococcus aureus to make sure that this fellow here does not go into crazy mode in that area there. Okay, now let's leave that for a bit and we look at what is working together with these bacteria on our skin and these micro on our skin, okay? Now, first of all, we have to realize that there is a very, very tight check and balance system working within our skin to make sure that everybody knows their job and they're not going to be overactive or underactive in their area there. Because the presence of these micro is extremely important to keep the homeostasis of our skin, okay? However, the homeostasis of our skin is not entirely controlled by the microbe on our skin or in our skin. It is only partially controlled. The other controlling organism is the microorganism in our guts, okay? And it is done through the immune system. And it's a very, very complicated system that is at work. Now, so let's go back to a little bit of the defense of the skin. We know that tight junction is a very important area. However, tight junction itself is not be all and end all. because it depends on the bioproduct of the other microorganism in our skin to help to maintain the integrity of that barrier there, okay? And these are the antibacterial peptide, the antibodies, the macrophages, the lymphocyte, dendritic cells, T cells, and B cells, and all that, okay? Now, we used to think that, the epithelial layer alone is impermeable to anything else that will come to attack. Well, turn out that that's really not the case. In fact, we are extremely vulnerable. Now, I'd just like to spend a minute to explain a little bit different, because we heard of the word microbiome, microbiotas, and all that a lot. The two terms are often interchanged. Sometimes it's not interchanged in the right way. So let me just make it clear. Microbiome really means that it is the microorganism together with all their genetics. And the combination of the two is called the microbiome. Microbiota simply describe the organism, okay, but not the genetic component, all right? And the metagenome basically means that it is the genetic expression of the microorganism, and it has nothing to do with the microorganism itself, okay? So if you see that term being interchangeable, don't be confused by it, because it is common practice. However, personally, I like to make a distinction between the two. Okay, so now, why does the skin want to partner up with the gut? So what's the reason for that? Well, there's a number of reasons. Now, let's first of all look at the basic anatomy of the gut. The important part of the gut that connected with our skin is purely in the area of the mucosa, okay? Outside of that, there's not a lot to do with it, maybe except the blood vessels, okay? So the mucosal area of the gut and the skin have one common thing, and they are extremely well supplied with blood vessels, okay? And they are also extremely sensitive. And this is why pain in the belly can be so devastating as pain on our skin, okay? Now, they are both unique in their function and the purposes for our body, okay? But they also play a very important role in defending us. Also in the neuroendocrine system. So in other words, it's not just in the immune system that it is happening in this connection. We're also looking at the endocrine system, which we don't often think about it, because we often think about the endocrine system has its own, from the pituitary gland right down to the adrenal gland to the thymus and all that. But you know what? That is just a very small portion of the adrenal system, okay? The real adrenal system is actually in the gut. All right, so now we know both are important to maintain homeostasis, not just on the skin, but also in the entire system of the body. It is very far-reaching. So in other words, the connection between the gut and the skin, basically they'll go back and forth, as we call bidirectional connections in that area there, okay? Now, the common ground between the two organs is the epithelial layer, okay? The epithelial layer is on the skin, is on the surface, on the outside, facing outside invaders. The epithelial layer of the gut is on the inside, okay? However, even though it is on the inside, but the gut is processing a lot of substances from the outside. So in other words, even though the gut is on the inside, but it's still facing substances from the outside, okay? So as a result of that, facing foreign substances that is not originally started in the gut. So both systems has a very, very intense immune navigating as well as monitoring system, looking over the stuff that it is in contact with to see whether it is harmful or is it going to be beneficial to the system, all right? And just for the sake of interest, I include a little footnote in the back there. And it says, human loses about 1/2 pound of cells into the intestinal lumen every 24 hours. That's quite a lot of reaction that's going on, and considered 28 feet of guts that we have in our body. So let's have a quick look at what is in the gut. Okay, what kind of stuff is happening in there? Well, of course, we have some very famous bacteria that we know now, lactobacilli, the E. coli, right? C. difficile and the enterococci, faecalis, and all that sort of stuff. But it really contains a lot more than just bacteria. It has viruses and have all kinds of little funny creatures that live in us. Okay, now, so we talk about earlier on dysbiosis. And what it really means is that when there's something happening to the composition of the micro in our skin or in our gut, or the change in the number of these micro within that colony, anytime there is changes, it becomes an imbalance. And that imbalance is what we now call dysbiosis. So that's a term that you're going to see quite often within the system in that area. So things could go wrong, believe me. It's the Murphy's Law, right? And so what are the things that go wrong very quickly with the gut? It is through diet, okay? Today's American starter diet has really greatly reduced the microorganism in our gut, okay? And what this diet does is to increase the permeability of the epiphyseal layer of the gut and the skin and the lung and the blood-brain barrier, okay, and oral cavity. Ever wonder why some of the people are so prone to canker sore? Well, you know what? The membrane permeability with the oral cavity has decreased, right? So it even affects placenta, because placenta is normally, shall we say, impermeable to a lot of invaders, a lot of future foreign organisms. But now we realize that a number of viruses can actually enter because of the fact that we don't have that protection integrity anymore, right? Now, we are very popular with probiotic. Everybody talk about it, probiotic. But in reality, probiotic is not that successful. And the reason for that is because the effectiveness of the probiotic are affected by two different things. Number one, whatever medication a person is on, even Tylenol is going to affect how effective your probiotic is going to work. And secondly, the food that the person is eating is sometimes work right up against the probiotic because of the typical, shall we say, North American diet. So what is happening in the North American diet is that the ingredient in the industrially processed food, okay, is such that it is only absorbed mostly in the upper portion of the small intestine. And as a result, the large intestine is not getting the benefit of the nutrient. The reason being because these industrially produced food is very high in sugar, very high in sodium, very high in fat, and also calorie, but very, very poor in nutrient. And they're designed to be quickly digested and taken into the system. And because of that, they become somewhat, shall we say, addictive to the system. And as a result, the large intestine, okay, become in, shall we say, in a state of famine. Because the large intestine is geared to digest food that the small intestine cannot digest. But since these foods are made to be utilized by the upper portion of the small intestine, there's really nothing left for the area of the large intestine, such as the colon, to actually absorb and be beneficial to us. And that leads to dysbiosis of the micro within that system. And when that happens, when that breaks down, inflammation starts happening. And some of them are called that leaky gut, okay? And that creates a huge amount of problem and a lot of pain in the people. Now, what is going on the inside of our body? Well, first of all, the large intestinal tract is home to a number of microbial ecosystem. I'm not just talking about microbiome now. We're talking about actually an ecosystem of their own, okay? Because each of these colonies are responsible to do certain things. And what they do is that they will take the undigestible fibers in our diet and cause digestion, fermentation, breakdown. And they produce biomolecules that are specifically helpful to other distal organs in our body. Okay, so each of them has a specific destination. Okay, and if we don't do it right, then these things are not happening. Okay, so that, however, this dynamic system that is producing these biomolecules are easily affected by diet. And of course, some other environmental problem. Unfortunately, genetic is also a part of it as too, because some of us are unable to digest or handle certain, shall we say, ingredient, such as gluten, okay, which is very common these days. So the large intestine is a very, very crucial element in protecting us way more than the small intestine, because it's doing something the small intestine cannot function, all right? Now, the colon contains the highest density of micro within our system. There are between 300 to 1,000 different kinds of species that live in that system. And 99% of these gut bacteria come from about 30 to 40 different species. Okay, the rest of them are viruses and fungi. Okay, and bacteria and gut cells, now they're being very active on a daily basis, hourly basis, minute basis. Okay, so they are always renewing itself. Okay, so it's not surprising the byproduct and the dead cells and the used up bacterium and viruses and fungi make up 60% of the dry matter of the feces. It's quite impressive if you look at it, right? Now, 99% of the bacteria in the gut are anaerobic because they produce very little oxygen in the colon. However, in the cecum, where the small intestine joins the large intestine, those bacteria are aerobic and they do require oxygen to survive, okay? Now, the total genetic makeup of the bacterial, or the, shall we say, the micro in our gut, okay, is 100 times higher than the human cells. That's quite amazing if you look at the amount of material and information within the gut and that, okay. So now, earlier on I said, well, the gut is actually a very, very big, shall we say, endocrine system. Well, it is true, because what happened is that it produces about 30 hormone-like compounds and to allow the body to use and to be processed into the right kind of hormone that we needed. But it also produces a very important molecule we call the short-chain fatty acid. And we're going to talk a little bit about that because that molecule is extremely vital to our health. And it also controls and produce secondary bile acid. Now, that particular substance is a very important thing because excessive amount of secondary bile acid actually going to cause cancer. So we have to, it needs to be monitored, okay? And it also produce cortisol as well too. But there's another thing that is very important, and I'd really like to draw your attention to that, is the neurotransmitter that the gut is producing. And it is producing a huge number of it, okay, such as GABA, such as serotonin, dopamine, tryptophan, and these are extremely important chemicals to maintain, shall we say, the mental balance and the function of our emotion on a daily basis. Without it, is not good. So that means that if our diet is wrong, our head is also wrong as well too, and you won't feel too good. And depression becomes a problem, right? Okay, now let's look at some of the functional unit of these bacterium and these micro within the system, okay? So what they do in the large intestine is something that the small intestine doesn't do, and that is the large intestine is able to manufacture different kinds of vitamins and a lot of essential and non-essential amino acid as well too, okay? And now, of course, it's also responsible for getting rid of a lot of the toxic substances and stuff that are no good for our body as well too, okay? And the unique ability of the large intestine was able to break down what the small intestine cannot digest, especially the carbohydrate. And it is from there a lot of the biomolecules are being produced, okay? And of course, it also helps us to defend against infection from the bowel and from the other organ, because it will produce antibodies and antigens for the system to act on it. Right. Now, all these micro and the ecosystem of these micro operating entirely in the mucosal lining. And it is only in the mucosal lining that these guys are working, not beyond that, okay? So the normal inner colon mucosal layer is not penetrable by the bacteria. It's extremely tough, okay? So it's only in the superficial layer of the mucosa that all these activities are happening, okay? And so that inner layer of the mucosa of our large intestine basically separate the commensal micro from the epithelium layer, okay? Because the epithelium layer has its own defense system that to make sure that nothing comes through, hopefully, okay? Now, that layer of the mucosa, okay, is wired directly to our immune system. So in other words, our gut has a direct line with our immune system, okay? And which is something that we were not taught 30 years ago, you know? So here's a little representation of these mucosa layered in that area. First of all, on the left-hand side, you see the stomach. Now, the stomach has a very dense mucosal layer, even though the superficial layer is very thin in other area, but in the stomach is extremely dense and it's quite thick in that sense of that. So as a result, stomach doesn't have a lot of bacteria, okay, that can exist in there. Of course, there are exceptions, but the stomach is pretty resilient in that sense, okay? And the reason that stomach has bacterial infection or causing ulcer is mainly because the defense system within the gut is breaking down. So in other words, dysbiosis in the colon is affecting the function and the protectiveness of the stomach mucosa. Okay, so when we look at the duodenum, which is just below the stomach, okay, you can see a very thin layer of the dense, the inner layer of the mucosa, but you have a small number of bacteria present in that surface area. In the jejunum, you can see a little bit more increase. However, the inner layer of the mucosa is still kind of thin, okay? As you go into the ileum, you can beginning to see that there is a little bit more increase in the inner mucosa, and there's also a bit more bacteria in there. And by the time you get to the colon, you can see a lot of bacteria happening in the superficial layer of the mucosa, while there's nothing in the inner layer. And as you go to the distal colon, you can see that the inner layer become very, very thick and is extremely resistant to the bacteria. So this is how we get our protection. Now, when we look within the epithelial layer of the system, there are other cells that are helping us to maintain that protection, to make sure that we are free of any invasion and any threat in that area there. And the first one I'd like to discuss is one called goblet cell. The goblet cell I nickname is the undercover agent because this guy is watching a lot of stuff, okay? And it is the main producer of the mucus within our gut, okay? It's a very useful fellow, okay? And it is not only a mucosa producer, but it's also a very dynamic system. The reason is because it's linked directly to the immune system, okay? So this guy is a go-between, okay, between our epithelial layer of the gut and the immune system, okay? So what it does is that it constantly sampling anything that comes through the gut, okay? And if there's any foreign substances or antigen, it will then present these genetic material to the dendritic cells, okay? So now, so it passes on that information to the dendritic cell. And it's a very, very, shall we say, complex connection between the globule cell and the immune system, because they talk back and forth, okay? And they work with multiple partners, okay? And they are extremely powerful controller of the homeostasis within the gut, and of course, affecting other areas such as the skin as well too. So when the globule cell presented the antigen or the information about the foreign substances onto the dendritic cell, well, the dendritic cell then go into action. Now, dendritic cell exists practically in every tissue and every organ in our body. It's everywhere, okay? I call it the informant. The reason because it then start talking, okay? Talking to the immune system about what is going on. Now, dendritic cell come from the bone marrow, okay? It's part of the bone marrow leukocyte, okay? And what it does is that it does what they call initiate adaptive immune responses. Now, adaptive immune responses means that they tell the other fellow what to do and how to react. They themselves don't do it, okay? The differences between that and, shall we say, the direct immune response would be something like the macrophages that directly attack the invaders and engulf it. Well, dendritic cell tells somebody else to do the job, okay? So this is what happened. Okay. So they inform other people and say, okay, listen, T cell, you should start acting. B cell, you should start producing the antibodies and stuff like that. So this is what the dendritic cell does, okay? Now, this is a very busy picture. So I'm going to make it a little easier to understand exactly how the dendritic cell is working within our system. So now, it is coming from the bone marrow, as we know, okay? And it tells other people what to do. So how does it do it? So as it left the bone marrow, it is what we call pre-dendritic state. And that means right at that stage, it has no messages to give anybody, okay? It's like a blank page, I said, okay? But what happened is that when that dendritic cell is being presented with the biochemical substances from the globule cell, okay, now, or maybe in direct contact with the antigen that comes into the lumen of the intestine, okay, now it started to mature, okay. And what it means by mature is that it will then now form a system of information to tell the defense system of our system to produce certain chemicals, cytokine, chemokine, to attack that particular type. So in other words, dendritic cells, when they meet up with the enemy information, they will form specific defense strategies against that type, but not against other type. So it's not a universal thing. It's very species specific in that sense. So what it does is that it triggers, okay, the T cell to develop different subset in order to fight this particular invasion. So when the dendritic cell, the one you see in the beige color, receive the message of the antigen, it will then pass that information onto the regulatory T cell, or we call it a naive T cell. And the T cell then will produce a subset, a number of other helper cells. And these one then go and tell the B cell to produce the antibody to fight the situation. So it's a very interesting systemic communication from one to the other. No. Now, on the other side, you can see the blue one, that the macrophages. Now, that one directly attacks the substances or the antigen or the bacteria or the invaders. But dendritic cell is another system that helps to destroy the invaders indirectly through the other system as well, too. Okay, so it's a very, now the thing is, because macrophages cannot be in everywhere, so dendritic cell actually make up the differences to make sure that there's no loophole in the defense system so that we can be protected, okay? Now, in the skin, it's a little different because the dendritic cells now has a direct talk with the Langerhans cells, okay? Now, the Langerhans cells, remember earlier on, is responsible to determine whether the skin should react with an inflammation or should tolerate it. Okay, so this is a situation with the dendritic cell when they get to the skin area, away from the gut, it has a different function and it reacts differently. So now, so how does the gut problem become the skin problem? All right. So what happened in that area? Well, remember early on I said short chain fatty acid. Well, if the gut commensal bacterium or flora is going into an imbalance, it affects the production of short chain fatty acid in there. Now that create the T junction, or shall we say the tight junction barrier problem, because now it become more permeable, okay? And as a result of the permeability, now your pro-inflammatory cytokine and chemokine is going to start entering the bloodstream, which is not supposed to happen, but it is happening, okay? Now with that happening, then the T cell within the gut will start to increase in numbers and migrate. But they also migrate together with the other chemicals into the circulation. And it is through that circulation, it will go to distant organs. And I say designated organ because what happened, if you remember, that each type of the reaction that the dendritic cells has caused will have specific function and specific duty to go to specific organ or destination. So they don't go right through the whole system. They go to an area that were designed to do so, okay? So the destination really depends on the specific microbiome problem that is in the gut, okay? So now let's have a little look at short chain fatty acid. What does it do? Well, it is a product that comes out from the dietary fiber that are being fermented by the large intestinal microbiotas, okay? Now, it is a very important substance because it affects the production of lipid, energy, and vitamin in our system, okay? It also controls appetite and the health of the cardiovascular system. And it is extremely essential to maintain the health of the colon itself and the energy that it needed to process and synthesize all these chemicals and the product that we needed. So short chain fatty acid is an extremely important assistant to the large intestine, but it also has the function and as a protective role against inflammation and against arthritis, allergies, and colitis and all that. So in other words, short chain fatty acid in its right amount will protect us from a lot of these inflammatory conditions. In the wrong amount or in the shortage of it, is going to create a lot of trouble, such as ulcerative colitis in that area. So what it does is that when it is produced by the large intestine, it will go through the system two ways to protect us. The first one is directly in the gut, in the epithelial layer, okay? It will stimulate the B cell to fight against invaders through the development of immunoglobulin A. But at the same time, short chain fatty acid can also go into the bloodstream, okay, and create a much more systemic reaction and defense against the invader through the immunoglobulin G as well as A. So it is protecting us both in the gut itself and also in the circulation in general. So it is a very important function to prevent any unnecessary, or shall we say, uncalled for inflammatory disorder that we suffer as a result of that. But it also controls, interestingly, short chain fatty acid also control the bacterial flora, or shall we say the microbial flora of our gut, of our skin, as well as the amount that is in there, the colony that are functioning, and the homeostasis of the skin. So this little chemical is not just functioning within the gut, but it also travels to the skin to maintain that homeostasis in that area. Now, short chain fatty acid basically help to suppress any, shall we say, undesirable inflammatory proliferation, okay, or the migration of those inflammatory cells. And it help to reduce unnecessary cytokine production that could harm us, okay? And it also controls the activation and the disposal of any immune cell that are either needed or undesirable ones. Okay, so basically the one that they needed, they will activate. The one that they consider undesirable, they will kill. All right. So in the skin, the short chain fatty acid also has a very important function, and that is it works with the stem cell. It regulates the stem cell activity that will help to heal the lesion of the skin that the person is suffering. So short chain fatty acid in its deficiency can create a lot of skin problem as well too. Okay, so what happened if the gut flora goes wrong? So what will happen to that? Well, the first thing that will happen is that some of the functions of these commensal microbes are now missing, okay? And maybe they're underfunction. The second thing that is causing problem is that the breakdown of the tight junction, which is catastrophic, all right? And when that breaks down, the inflammatory units and the chemical that is in there now started to spread through the circulatory system, okay? And there's another system they can spread, which is, we would realize it in the past couple of years, and that is through the interstitium. But we'll talk about that in a little bit later. But the spread of the inflammatory chemicals and the units of these things now go through the system. And they usually target certain area because these inflammatory reaction chemicals are very, very specific, or shall we say species specific in that sense, or destination specific, okay? And once it started, it self-perpetuates itself. It doesn't stop. And this is why things like, eczema, psoriasis just keep going. And they just drive themselves, basically. And they create permanent damages and a lot of complications in patients that suffer from that, okay? So now, the so-called gut microbial dysbiosis, well, it itself is a very, very potent stimulus because it is a very important event. It's not just an event, it's actually a stimulating energy that create problems, okay? Because the problem they create, it could hurt itself and also distal organs as well too, when there is an imbalance, okay? So what causes this imbalance and what happened when this imbalance happened? Well, when the imbalance happened, something very interesting is being released in the gut, okay? It's a substance, a chemical called zonulin. Now, this guy normally is quiet, even though it is made by the gut, but is normally very quiet. It doesn't come into action unless something upsets it. Once it's upset, this actually changes the permeability of the intestinal tight junction. Now, which is kind of interesting because this is a substance that can actually destroy our own tight junction, even though our body produces it, even the tight junction is needed, but we have a chemical in there that could undermine this whole thing, okay? And when that happens, now we have a leakage in the tight junction, thanks to the zonulin. And when that zonulin becomes active, it is activated through the chemical called the epithelial growth factor. And this is creating a situation where the leakage of the antigens and all the pro-inflammatory cytokines and chemokines started to rush into the bloodstream, okay? And these inflammation then start to appear in distal organs that these specific chemical was destined to create trouble, okay? So, for example, we'll look at gluten, okay? When the gluten enters the intestinal content of a person that is intolerable to that, the gluten will then penetrate through the epithelial layer, okay, into the system. But when it gets into the system, okay, it starts to stimulate, okay, and causes the cell, a cell in our gut to produce the zonulin, as well as interleukin number 15. Now, the interleukin number 15 is not a good thing, okay? So the zonulin started to be produced. Now we create leakage, okay? And as the accumulation of the gluten get bigger and into the intestinal lining, now lymphocytes stimulated by the interleukin 15 now start to attack the cell within our gut, thinking that it is an enemy. And now we are seeing damages in the epithelial layer as well as the tight junction. And that is sometimes being referred to as leaky gut. And it creates a huge amount of problem because now inflammation is running right through rampant within the whole digestive system. Okay. Now, the interesting thing is when zearalenone level is increased causing this trouble, it's very hard to detect because you would think that with all these inflammatory situations happening, we should be able to see a high level of C-reactive protein or the erythrocyte sedimentation rate would increase, but it doesn't. So this guy is very sneaky, even though it is doing harm, but it's not that easily detectable because these reactions do not show up in the test. Now, so when these biomolecule of inflammatory reaction release into the bloodstream, okay, then they start reacting to the receptor of the immune cells at the barrier of the distant organ that it was supposed to attack. And in this case, it's the skin. So in other words, when these biomolecule of inflammatory substance from the gut release into the bloodstream and get into the skin, okay, the skin immune cell will react to that. And they will then start the inflammatory action within the skin. And that created a lot of opening up of the lesion, okay? And now the skin microbiome has a very important role, okay, in either protecting us or cause a lot of other skin conditions, okay? However, many of these skin lesion problems are always accompanied by an altered gut microbiome. So in other words, if the gut microbiome is not working well, the skin microbiome are not going to work well, and skin lesions will start to appear. So the influence of the gut on our skin is working through what we call a bidirectional linkage between the skin homeostasis through the immune system to regulate the healthiness of that. Now, the modulation of the immune system is really primarily controlled through the gut, okay? So in other words, gut is the largest immune system in the body, you know, right? Not just our lymph node, not our lymphatic system. It's the gut that is controlling and is the greatest immune system in the body because it does most of the work that affect every single organ from the brain right down to your toes, okay? And because gut and skin have so much in common in their purposes and their function, okay? And they are both essential in two functions, not just the immune function, but also the neuroendocrine function. When they are out of order, those two functions are going to be upset, okay? And because they bring on altered immune responses, not just the skin diseases, so it has a far-reaching effect. Now, here's a little diagram just to demonstrate how does the gut affect the skin situation. When on the left, we have healthy gut, okay, we can see that the tight junction is maintained, epithelial layers is intact, the number of bacteria is under control, okay, in the gut. And as a result, the skins are healthy and there is a normal microbiome existing in the skin. On the right-hand side, when there is leakage in the epithelium, okay, when the tight junction is damaged and the gut bacterium started to become imbalanced or dysbiosis, now through the bloodstream, it's going to travel to the skin and causes inflammation in the skin area there and create havoc in that. So the tight relationship between the two are extremely reactive and they talk to each other, okay? Now, the interesting thing is, you would have thought since they are bidirectional communication, the skin would affect the gut function and the gut would affect the skin function. But in reality, it is not, okay? The skin dysfunction, the microbiome dysfunction in the skin cannot affect the gut. It doesn't. It's the gut that controls how the skin is going to function. So in that sense, it is a one-way street because the gut dictates what kind of immune response the skin is going to do, not the other way around. So in other words, all these anti-aging gel that you pay a lot of money for is not going to improve your gut at all. I'm sorry. Okay, so save your money. I hope my wife hears that too. Okay, so other factor that comes into play. Okay, well, both tissue, I was just giving the finger, by the way. Both tissues are very responsive to stress and anxiety and mental and physical challenges. And we probably already know that, right? Because when you are upset or nervous, you don't feel well. You feel nauseated. That's right. Okay. So we know that. Okay. And your skin will crawl, right? Okay. So now, the other thing that they all share is a rapid turnover of the epithelium cells, okay? Because these cells are extremely active. They're working all the time. So the turnover is essential to make sure that there's always new one and fresh one to take over the job, right? Okay. And so what happened is that now when there is high number of allergy or pathogen in the gut area, it will then releases xulinin that increase the permeability of the skin and the intestinal barrier. So now trouble really start, okay? So in both areas, it can be very much, shall we say, troubled and attacked. And just like this turtle in the fishing net, and there's in all kinds of trouble. So now, negative emotion. Okay, let's just mention a little bit about that, okay? It definitely altered the digestive tract function. I mean, that's something that we're very familiar with, okay? But it also changes very quickly, okay, the flora with our gut, within our gut. Now, it is a very amazing thing. It changes extremely fast. The speed of the change is literally in hours. It doesn't take days for that to happen, okay? And the increased permeability of the tight junction also happened very, very quickly. It doesn't take days, and it literally takes sometimes only take a couple of hours for it to manifest itself, or even shorter, okay? And what happened is that when that emotional, negative emotion happened, it also disrupted the regulatory T cell's ability to suppress inflammatory action. You see, T cell can either suppress or activate inflammatory conditions. So by disrupting the T cells' ability to suppress inflammation, that creates problem as well too. So now we have a systemic inflammation throughout the whole system. Now the skin get upset in that area there. So how does all these messages and all these influence go from the gut to the skin? Okay, is it through the blood? Yes, it does. We do know that. We talk about that. Okay, when the DNA material of the intestinal flora break down and enter into the systemic circulation, okay, it will cause the T helper cell 17 and the regulatory T cell of the skin to go into an imbalanced functional state. And then now the suppression of the immune system cytokine is out of function. And now the homeostasis of the skin got disrupted, then skin lesions start to appear and they perpetuate, okay? So now, so that is through the circulation system. What about another way? Well, it does. Remember I said there is a direct neuroendocrine system that controls it? Well, the dysbiosis of the gut microbiome, okay, it can also alter the production of neurotransmitter. Okay, remember about the dopamine we talk about, the serotonin we talk about? Well, it also affects acetylcholine and norepinephrine. So it is through those chemicals that the message of the dysbiosis and the changes within that can travel through the peripheral organs, through the neurological pathway. It doesn't have to only go by the circulation itself, okay? Now, there is another pathway that we are realizing now in the past 2 years, interstitial pathway. And because the entire digestive system is encased within the interstitium, which we used to call connective tissues, okay? Now, this is the largest circulatory system in the body. So basically, these inflammatory compound is going to go into the interstitium circulatory system and reach many, many different distal organs. So it can upset the person. So in other words, if you have a skin lesion because of the upset of the gut microbiome, you can also go into a state of depression and into a state of upset, not just in the stomach, but also in your head. Okay, so it is a very interesting situation. There is also a possibility that it could also affect cardiovascular system, depend on the integrity of that person's health, right? So it can really initiate a lot of problem, not just metabolic within the gut, but also on the autoimmune system. Okay, people develop allergies in that area, psychologically, right? And also affect neurodegenerative condition, maybe an early onset of Parkinson, maybe an early onset of dementia, or Alzheimer. Well, it is quite possible because it does affect the brain, right? And of course, skin lesion is the least to worry about when you have all the other trouble, okay? But the very interesting thing that there are some evidence to show that it can also initiate cancer. So it is a very, very interesting spread, the way that goes. Okay, now let's look at a case study to see how photobiomodulation treatment can help patients with these problems, and a combination of skin lesion as well as gut microbiome dysfunction. Okay, psoriasis is the most common, shall we say, immune-mediated inflammatory skin diseases. Okay, it's one of the most prevalent conditions in the chronic disease in the world right now. It is affected through lifestyle, genetic susceptibility, as well as environmental stress. And all these are interplayed together, okay? So in other words, patients that have psoriasis don't just suffer from a skin problem itself. They can also have other problems that are either major or minor that exist in their health system or that area there. So there is definitely now increasing evidence that link the intestinal dysbiosis that's happening in our gut to the onset and the origination of psoriasis. So now we know gut microbiota has a crucial role in regulating the metabolism, the immune system function, and the intestinal permeability. And the disruption of these biodiversity and the composition of the microbiome will cause us a lot of what we call comorbidities, and such as inflammatory bowel diseases, inflammatory arthritis, depression, cardiovascular diseases, as well as skin lesions. So now let's have a look at the pathogenesis of psoriasis. So when we have gut dysbiosis, it will activate the dendritic cell. Remember that guy, right? The dendritic, that to produce pro-inflammatory cytokine, okay, through the T cells and the B cells in that area there. So that happen, when that happens, it will activate the T cell, the T helper cell 1 and 17, to produce tumor necrosis factor alpha, as well as IL-17 and 22. Now, these guys are extremely active pro-inflammatory chemicals. And so what happened is that now they really started the inflammatory situation in the skin. But at the same time, the dendritic cell also activate the fibroblasts within the skin to bring on activity of keratinocyte to proliferate and to produce in larger number. And these guys produces chemicals, pro-inflammatory chemicals, because once keratinocyte is activated, a lot of inflammatory chemicals and antimicrobial peptides are produced. And once that happens, then it becomes a cycle of chronic inflammation without any resolution whatsoever. So it just persisted and it goes on and on and on. So here's an example of our patient, a female, 33 years of age, okay, suffer from Down syndrome, also have hypothyroidism, okay. She also have immune thrombocytopenia purpura, as well as psoriasis. As you can see, that psoriasis lesion is pretty angry and pretty active. covering almost the entire shin of the leg in that area there. And this is another view of that particular situation. So remember, I say psoriasis, when you have dysbiosis of the intestinal function, you're going to have a lot of other comorbidity problem, and in this patient, suffer from more than one condition other than the psoriasis itself, okay? So they try every conventional medical treatment that can be given, lotion, medication, light, the whole work, but it doesn't seem to do anything. And this is the purpura that she suffered from as well too. She will bruise and blood vessel will break very easily, which is very unfortunate. And this kind of situation also delay healing, because when you have a circulatory problem, then the recovery speed is also retarded as well too. So when we treat the leg as well as the abdominal area there, we see a change in the psoriasis in the patient there, okay? And so it goes to show you that the laser treatment needs to be applied to both the lesion itself and at the gut level. And at the gut level, what it really does is not to introduce new bacteria into the area. It is more to repair the tight junction and to reduce the inflammatory reaction so that this gut has a time to reset and mend itself in some way, okay? So as we apply this, the patient continue to recover from that. And the protocol that we use for the leg is that the red array is in the continuous form, the infrared array is at 1030. For the abdomen, the red array is continuous while the infrared array is at 1030. And it's 8 minutes each for all the array that we applied in the area there, okay? So this is what we use. And it really was quite helpful to this particular patient. And this is how we put it on the abdomen. And you notice that with the COVID and all that, our arrays are wrapped in plastic to make sure that we kept the highest standards of safety and hygiene. So this is how the biomodulation helped to maintain the commensal of the gut to function in its best possible way, so that we can reduce other coexisting problem in the system. So in conclusion, the skin really is a reflection how the gut is working, okay? Dysbiosis of the gut microbiota will reflect through the collapse of the skin microbiome homeostasis. And the two are so closely related. We have to make sure the gut function is always at its best and as healthiest. As the old saying go, you are what you eat is extremely true. You eat garbage, you get garbage. You eat good food, you get healthy. Thank you very much. Appreciate that. I hope you guys enjoyed the lecture. And if you have any question, email me.
Okay. So next up, I'm going to talk a little bit about skin rejuvenation. I'm sure a lot of you are interested in that. It's really fascinating listening to Ben speak is that when you approach, treating the skin, oftentimes you may not think about these other factors, especially treating the biome, the gut biome and the sternum. So and diet as well. So these are all things that need to be tied in together to get, the overall best results. So thank you again, Dr. Yoon. I really appreciate your time today. So I'm going to talk a little bit more in depth about the skin itself. It's really important that we understand all the different layers and what's going on in the skin, because this is really what we're targeting, or we're targeting certain aspects of this. So it's important to understand about that and understanding about how skin ages. So I'm going to review that, and then specifically I'm going to get into light penetrating the skin and what kind of effects we can expect from photobiomodulation on the skin. And then I'll talk a bit about how you might apply BioFlex treatment to help rejuvenate, you might say, the skin as well. And then I'll delve a little bit more into acne. Dr. Ewan touched on it a little bit, and it was interesting. He talked about some different aspects of acne. I will probably review what's sort of, traditionally or classically understood about the causes of acne. And Slava will be presenting some case studies on acne, and we'll delve into the customization and protocols for acne as well. So that's what I'll be covering. So a few facts about the skin that are interesting. As Dr. Yuen mentioned, it's the body's largest organ, and it tends to be on average about 2 millimeters thick. And the thickness is important because when we're using photobiomodulation and light, some light penetrates deeper than other light, right? So that's important to understand. Obviously, it shields us from external factors. It regulates body temperature and sensory information. It stores fat and it stores water. Of course, we know about its role in vitamin D. And as Dr. Yuen mentioned, its critical role in the immune system as well. As we know, the color and thickness and texture varies depending where you are in the body. And there are two types of skin. There's a thin, generalized skin that you find most parts of your body. It tends to have hair follicles. And there's the thicker portion of skin that's hairless. And again, typically, of course, that would be in your palms of your hands or the soles of your feet. So let's talk a bit about the three layers, the generalized layers of the skin: the epidermis, the dermis, and the subcutaneous portion, or the hypodermis region. I'm going to talk now about the epidermis. So this is, of course, the outermost layer of the skin, and actually consists of 5 distinct sublayers. And when we think of epidermis, we think, oh, it's a very thin outer portion of the skin, but it actually has a whole bunch of layers there. And the thickness definitely varies. I mean, on your eyelid, it's as thin as 0.05 millimeters, so extremely thin, which means light can penetrate through that very easily. And other areas like the palms or soles, and it can be as much as 1.5 millimeters in thickness. Contains lots of different cell types. I'll talk about these cells as we go along in today's presentation. So the innermost layer of the epidermis, so that's the deepest layer of the epidermis, consists of round basal cells. You can see in the bottom right diagram there what they look like. There's a basement or basal lamina there as well too. And these cells, these basal cells, are what constantly divide and create new cells, and then they start to be pushed up and migrate towards the surface of your skin. And this is, of course, what happens quite extensively when we're younger. But of course, as we age, then this starts to slow down. And of course, we'll see what happens. Now, this basal cell layer is also called a stratum germinativum, and it's mainly because it produces germinating cells, so cells that replicate all the time. And you probably know that photobiomodulation increases the mitotic index, or the MI. Mitotic index is basically how frequently a cell turns over or replicates. And we know that stimulation with these wavelengths that we use increases the mitotic index. This is one of the first things that was actually discovered by Andre Mester back in the 1960s. He actually measured the mitotic index of cells that were being treated with photobiom. At that time, it was just lasers, right? Laser therapy. Of course, there's melanocytes. These help protect the deeper layers of the skin from the harmful effects of sunlight, specifically ultraviolet. And these melanocytes, of course, produce melanin, and this will protect the skin, and that's critical. Now, melanoma, and I'm going to talk a little bit about melanoma, because if you're treating skin, and even if you're not treating skin, a really important thing to observe is a patient's skin, and perhaps as we age, different types of skin cancer. So I'm going to talk a little bit about melanoma, because we all know that melanoma can be a very deadly disease, right? Not so much if it's caught early, but certainly if it's not looked at the beginning. Merkel cells are also in this layer, and these are tactile cells that sense tactile touch. And they're located within the basal layer as well. Now, for melanoma, by the way, the site I use for this is a really good site, and you'll see the link to it, or the website. It's called skincancer.org. And if you go to that, it covers all the different types of skin cancer. Really great informative site. It should be in your manual, but if not, just, I know it is, but just might be small to read or whatever, you can note it down right now. So when you're working on skin, or you're looking at your own skin or your partner's skin, or whomever, your parents as they age, you want to look for certain aspects of discolorations and moles or just unusual things. And it's usually referred to as the ABCDEs of melanoma. Now, I'm just covering melanoma right now, not the other types of skin cancer. So A stands for asymmetry. Essentially, normally a mole is pretty much, when you divide it right in half, it looks the same on both halves, right? And melanomas, they tend to be asymmetrical. So when you divide it in half and you look at it, you'll see that there might be irregularities compared to the opposite side. So that's one sign that maybe something's not quite right. And B is for border. And I think a lot of you are aware that melanoma in particular has uneven borders. You can see an example here compared to usually a smooth border of a standard or common mole. And by the way, please ask me questions as I go along. I'll get to those definitely at the end of the lecture. C is for color. So one of the warning signs for melanoma is changes in color within an abnormal mole or skin coloration. It could be some red or some blue or some black. There's different colors that may appear, and that looks unusual. So pay attention to that as well. D stands for the diameter and darkness. Diameter in general, they say if there is a mole or a skin discoloration that's greater than about 6 millimeters, and 6 millimeters, if you think about it, is the diameter of a pencil, the eraser on a pencil. Remember the days when you used to have an actual pencil with the eraser tip on it, the good old HB pencil? Well, think about that size. So if you're seeing something that's larger than that size, then that should raise some red flags, and you should definitely get it looked at, because that's typically not, doesn't mean it's cancer, but it's something that you should be aware of. And darkness, in general, melanoma tends to be darker. So you see darker colorations within the mole as well. E is for evolving, and essentially that means that anything that discoloration or mole that seems to be growing in size or shape or color or elevation, any new symptoms like bleeding or itching or crusting, anything unusual or new or that hasn't been that way for the last month or years, then again, that's a red flag to get checked out. I know for myself personally, I had something on my back shoulder, and I thought this looks a little odd, so I ended up having a biopsy done just to be on the safe side, right? It's very quick, easy to do. Fortunately, it was negative, but you just never know. So if you catch melanoma early, it's a 90% success rate of healing it, of curing it. So the key is, of course, like any cancer, is early detection. Okay, so moving on with the epidermis, the next layer is a squamous cell layer, sometimes called the stratum spinosum, or the spiny layer. And this consists of maturing basal cells, so the ones that are sort of shifting up. They're now called squamous cells or keratinocytes. And these keratinocytes are really important because they secrete collagen. And that's probably one of the main things when we talk about rejuvenation, is to get more keratinocytes that are secreting collagen to help with the thickness and the appearance of skin. So of course, we know keratinocytes produce keratin. It's this tough protein, collagenous protein, and of course it makes up skin and hair and nails. I think we're all familiar with that. The keratinocytes, the next layer up from that, there's sort of two layers in the squamous layer. These are the stratum granulosum, and then above that are stratum lucidum and the stratum corneum, or the very external layer. So these cells, they start to migrate towards the surface of the skin. They get bigger, they sort of flatten out, they start to adhere to each other. Eventually they kind of die, become dehydrated, and this is what forms the most outer layer, the stratum corneum. So this outer layer is anywhere from 10 to 30 cells, thin cell, dead cell layers thick. So these are keratinocytes that have lost their purpose in life and have died and eventually get sloughed off, as we know. It's also sometimes called the horny layer because they appear like horns of an animal. I guess this is why they named them that way. So the stratum corneum, again, this shedding process actually slows down with age. And really that has to do with the metabolism of the layers deep to the stratum corneum, which is why the skin starts to appear quite thin as we get older. In general, the complete cellular turnover of the skin is around 28 to 30 days in young adults, but the same process as you age can take much longer, sometimes almost double the length of time in elderly adults. So a much slower turnover, again, relating to metabolism. The dermis is the layer deep to the, of course, to the epidermis. You can see it has lots of different structures in there. It's anywhere from 1.5 to 4 millimeters thick. And again, the reason why I'm mentioning these things is that, you know, when you're using light, and red light's used a lot for skin rejuvenation. In fact, that's probably the most common wavelength that you'll see. Sometimes I use blue, but blue isn't that great. And I'll maybe talk a bit about that later in the fact that it really doesn't penetrate very deep. It's not bad for the first millimeter or so, but it's not going to go deeper than that. It's pretty good for acne, by the way, because it helps to kind of destroy some of the bacteria, but it's not going to go deeper. And infrared is even better for these deeper layers, depending on your skin thickness as well. So it makes up about 90% of the thickness of the skin, the dermis. So the healthier the dermis, the thicker your skin appears. One of the main functions of the dermis is regulation of body temperature, and this has to do with the blood supply, right? So most of the body's water supply is actually stored within the dermis itself. And the dermis consists of two layers, a papillary layer, which is the outermost layer, contains some collagen, and it's going to supply nutrients to the epidermis above it, right? So it has a very robust vascular system. And again, this vascular system can constrict and relax, controlling the volume of blood. And of course, this will help with heat loss. If we're getting hot or we're in a hot climate or sweating, then of course, we'll get vasodilation in that area. The lower layer is called the reticular layer. It's a little bit thicker and it has lots of collagen. These collagen fibers are in parallel surface to the skin. It's quite a bit denser than the papillary layer, and it's quite strong, provides structure and elasticity to the skin and helps support components of the skin. So this reticular layer is what would be really important in maintaining the turgor or the sort of skin suppleness, you might say, as in our younger years, and we want to try and maintain that as we get a little bit older. So it also contains lots of really interesting specialized cells. Of course, we talked about blood vessels, transporting oxygen and nutrients and waste products, and of course vitamin D into the body. There's lymphatic vessels, of course, critical for lymph flow and lymphocytes. Of course, there's hair follicles. There's sweat glands, and there's two types of sweat glands. I think we're all familiar with that. The apocrine glands are in the axilla and the pubic region. Tends to be a sort of a milky substance looking like sweat, a little bit different than the eccrine glands, which are almost basically water. Of course, there's some other components in there. And as the eccrine glands, these are the true sweat glands, and that help, of course, help regulate your body temperature. They can produce up to 2 liters of sweat, or again, mostly water, an hour if you're really exercising a lot, right? Or in a really hot environment. So it just shows you how critical hydration is and for the health of skin. Because if you're dehydrated, then of course, that water will be lost to other parts of your body that require it more than your skin. and prolonged dehydration, even small amounts of dehydration, the skin's health is compromised. There's also sebaceous glands, and I think Dr. Ewan mentioned a little bit about with respect to acne. These are attached to hair follicles, and basically found most areas of your body except for the palms and the soles. This oil it secretes, it helps to keep your skin smooth and supple, waterproof for the most part, and it's going to also protect from bacterial infections and fungal infections from taking hold in the skin. Okay, next is the most deepest layer of the skin, the hypodermis, or subcutis is sometimes referred to as. So it's the innermost layer. It has quite a good network of fat as well as collagen cells. So later at the end of today, I'm going to talk a little bit about photobiomodulation and its effect on fat cells. And this is the layer, it's the deepest layer that we're trying to target. And so the fact that it has a fair amount of adipose cells and fat tissue, then it's going to function as an insulator and, of course, to some degree, a shock absorber when we fall on our big derriere out there on the ice. So just be careful with that. So, of course, it's going to store energy as well. It has lots of lymph vessels and nerves, and of course, hair follicles also can travel through this layer as well. And obviously, the thickness is going to vary depending on the person and what area of the body that you're referring to. Okay, so now let's talk a little bit about the aging process of skin. It's a pretty I mean, I spent a lot of time sort of, looking at all the research and the information out there, and obviously it's really complex, and there's lots of factors that affect your skin aging. And so, while many of you out there are interested and maybe even signed up because you want to learn more about what photobiomodulation can do, and definitely that's my goal, but one should also understand there's all these other factors that you should, if you're treating patients for this, then or clients, then you need to also educate them as well. So there's intrinsic factors. These are not as variable, obviously. So these intrinsic factors are basically a natural consequence of physiological changes over time. So there's genetic variable rates as well, and you can't control that, right? Extrinsic factors you can control, right? So think about exposure to sunlight, in general pollution, nicotine, repetitive squinting or frowning, believe it or not, diet, as Dr. Ewan talked about as well, sleeping position, also, and your overall health. These are all things that you can actually, for the most part, help to change and can improve or slow down the aging process of the skin. So these factors can affect the structure and the function of typically the epidermis and the dermis itself. So histologically, the aging skin typically shows epidermal atrophy, and that's really due to the decreased cell numbers. So as we age, less cell numbers, less mitotic index, as I mentioned earlier, and then the skin starts to show signs of atrophy, thinning, and wrinkles, that kind of thing. So there's also a decreased number of mast cells and fibroblasts. Now, it's fibroblast deterioration that really contributes to skin aging. And it does this by secreting specific enzymes. These enzymes impair or decrease the release of essential growth factors by fibroblasts. These enzymes can also degrade what's referred to as the extracellular matrix, or ECM, as well as these really fascinating enzymes called matrix metalloproteinases that even Dr. Ewan was talking a bit about. Extremely complex, but these MMPs in general tend to be harmful to cells. And it's really fascinating that photobiomodulation has a fair amount of research to show it can help modulate cells to decrease these negative MMPs and help with the cell to overcome inflammation and even aging as well. So there's quite a few mechanisms involved with skin aging. Even there's been suggestions of telomere shortening, oxidative stress, which makes sense, right? And we know all about oxidative stress because I talk about that in photobiomodulation, the mechanism of action. I talked about these MMPs and cytokines, these microRNAs, which is an interesting kind of protein, and of course the microbiome that Dr. Ewan has spoken to us earlier today. So it's quite complex. Now, let's get into a little bit about photobiomodulation and have a bit of an understanding here that when you say light penetration with respect to photobiomodulation, then I'm only referring to light that not just penetrates, but has enough energy density to trigger a therapeutic photochemical reaction. So when I say penetrate, I'm talking about not just penetrating, but actually resulting in a positive effect. Okay, so it has to have enough absorption of these photoacceptors, like cytochrome C oxidase, of the target cell to create a reaction. So when you put the light source on, like the arrays of the BioFlex array, the light's going to be scattering, reflecting, bouncing around, and down to a certain depth, but it's where it has enough of the energy to trigger enough reactions to cause a positive effect that we're all about. That brings me to how deep this light can actually be effective for. I mentioned about blue light. If you look at this kind of schematic diagram, you can see blue light penetrating really just through the epidermis and not a whole lot deeper than that. So it's very effective for things right on the surface of the skin, but it doesn't really have any ability to penetrate deeper than that and have any positive effect, which is really why we have focused on red light and near infrared light. I'm not going to talk about green or yellow because in general, those are wavelengths not used in photobiomodulation because, again, not penetrating very deeply and not thought to be absorbed very well by cytochrome C oxidase. Whereas red light, you can see, and red light, by the way, is 630 to 700 nanometers. I would say 630 to 680, and preferably 660 to 680 nanometers seem to be the best wavelengths. And you can see it's going to penetrate through the epidermis, into the dermis, and even approaching into the subcutaneous layer as well, the hypodermis. Now, of course, this will depend on the thickness and where you're applying the pad, but notice that it's not penetrating very well into the fatty region of the skin. And that's where the infrared seems to do a better job. And it's interesting because I'm going to talk about the research and fat reduction with light therapy, and they use a lot of red light, and they seem to get some results, although not all the time. By adding infrared, the results should be even better because you can see the light penetrating all the way through the fatty layer and into the muscle layer as well too. So definitely near infrared is what's going to penetrate and be effective to greater depths. When we talk about skin, red light for sure. In fact, sometimes I'm just going to recommend red light, but infrared light allows you to take that light and penetrate and to be used effectively into the deepest layers of the skin as well. So when you talk about skin rejuvenation, and many of you probably are familiar with some of the common, if you walk through a Shoppers Drug Mart or a drugstore, I know here in Ontario, you walk through it and you have to actually say hello to the cosmetic person before you do anything. And that's a big part of their business. And a lot of that is stuff like retinoic acid and different chemicals, and of course dermabrasion, chemical peels, ablative lasers. If you go to med spas, these are all therapeutic modalities commonly used to help resurface the skin or help with skin rejuvenation, and they all basically are looking at controlled epidermal removal. That doesn't sound particularly like something I'd want to do, but I've never had it done, obviously. You look at how old I am, but when you see pictures of people who've had it done, maybe you had it done yourself or whatever, your skin is quite raw and red afterwards. And it takes a little bit of time for the skin to heal. So one of the ways that photobiomodulation can be very helpful with respect to these techniques is to use it after you're having like a chemical peel or dermabrasion or what have you. And you will see a marked improvement of the time, decreased time to get back that skin to looking more normal. But that's not what I'm really all about here. I'm talking more about the fact that photobiomodulation without these therapeutic modalities can help with skin rejuvenation. And it all comes down to collagen biosynthesis. We all know about collagen, and there's different ways of ingesting it, putting it on your skin and all the rest of it. But those techniques tend not to be great because you have to get collagen to where you want it, and it has to penetrate through layers of your skin, and it's very difficult to do that. Your best way of doing that is to increase the synthesis or the biosynthesis of collagen in the fibroblasts in the skin. And how do you do that? Well, with photobiomodulation, you can do that directly with light absorption. Okay, so the problem with these therapeutic modalities is that there is obviously possible complications, infections, like the erythema can be long lasting, there can be pain. I mean, there's potentially complications there. So if you're willing to sign off on that, that's fine. But if you want to do something non-invasive with zero side effects, then photobiomodulation would be one way of looking at this. So PBMT has been shown to be effective to improve skin conditions like wrinkles, skin laxity, to a mild to moderate degree. We're not talking facelift here. We're talking enough that you'd be able to notice a difference if you did the treatment long enough. Okay, so basically how it's working is it increases the production of procollagen, which is the precursors to the actual collagen fibers themselves. And then things like increasing fibroblast growth factor, or BFGF, which again is going to help these cells with respect to secreting collagen, proliferation or increasing the mitotic index of fibroblasts, and decreasing those MMPs that both Ben and myself have mentioned earlier. I'm not going to go on about MMPs because it's extremely complex. If you're interested, then I suggest that you maybe do a bit of research because it's quite fascinating that these enzymes can really create havoc in the body. So increased MMPs really relates to increased aging of the skin. When you smoke, around pollution, other extrinsic factors, MMPs are increased. And of course, that causes premature aging of the skin. So now here's a fun diagram, right? Like if you look at this, I mean, you're seeing all sorts of things going on. Like don't worry about the blue light. If you look at the red and near infrared light and go look beneath that, you can see all sorts of effects of the light on these cells, all these different cell types, decreasing tumor necrotic factor, increasing interleukin 10, synthesis of growth factors, all this whole vast array of things that can occur in the skin. And by the way, when we normally lecture about treating like bursitis or tendonitis or ligament sprains, a lot of these things are also in play as well. So it's interesting that aging skin, while is a normal process, it can also, excuse me, it can also be accelerated and occur prematurely. And there's ways of helping to slow that down. And so photobiomodulation, along with these other things, can definitely help trigger these positive effects in the physiological processes of the cells of the skin. Excuse me, I'm just going to have a little sip of water here since I seem to be froggy. So let's look at some of the research. This is a very recent paper published in 2021, and it's kind of a review of photobiomodulation and the clinical applications as it relates to cosmetic medicine. Oh, notice, by the way, the author is a specialist plastic surgeon. So it's really interesting now that we're starting to see some of these MD specialists be aware of photobiomodulation. And it's just growing. Over the last 5 years or so, we're seeing a huge amount of interest in all fields of, traditional medicine and photomedicine and photobiomodulation. So this particular author, Dr. Graham, this is just one of his case studies in this paper, and it was a 73-year-old female. Now, there's a few things I want to point out. Well, the before and after, it's quite dramatic, right? I mean, it's a 73-year-old woman. She was using a device on on her face, excuse me, that was red and near infrared. So basically identical to what you'd be using with a BioFlex array pad, about 20 minutes a day. And it was daily. And it was for 12 weeks. Okay, so don't kid yourself. You're not going to see results treating once a week for a few weeks. If you're doing this in a clinical setting, which is perfectly fine, I'll lay out the treatment plan, but you're not going to be treating these patients once a week. Okay, the treatment plan should be a lot more. And in fact, to be honest, if they can supplement some of their treatment at home as well, that's even a better scenario. But if you look carefully, you don't even need to look that carefully. Look at the forehead and the difference. These aren't photo changed at all, whatever that term is, changed at all. Obviously, it's a journal. It's a peer-reviewed journal. You can look at the wrinkles around the upper lip as well, and the chin. It's quite a dramatic improvement, and this all has to do with stimulation of the cells that are secreting collagen and extracellular matrix to make that appearance of the skin seem less aged, and that really has to do with the thickness of the skin. But of course, that does take quite a while. Remember, I mentioned earlier, it can take up to 50 to 60 days for cells to turn over in the skin. So you need to be patient if you're going to do photorejuvenation. Another paper, this one specifically looked at split face clinical study using LEDs. A lot of the work on the face is LEDs. It's just much safer and, to be honest, very effective. And what was really good about this paper, it's a little bit older now, but it's still great because they actually looked at the skin. They actually took samples of the skin and they measured, different things to see what was going on post-treatment. So they looked at 76 patients. They were specifically looking at facial wrinkles, treated one half of the face. They were randomly divided into groups that received only infrared, only red, combination of red infrared, and sham. Here they treated twice a week for 4 weeks. So not that much, but still enough because they still got fairly good results. They also looked at the skin specimens, and they were looking at, again, right, MMPs. They were looking at tumor necrotic factor. I mentioned that earlier, certain interleukins, all these different biochemicals that are important markers of what's going on in the skin itself. So here's an example. If you look at the wrinkles at baseline, and then you look at, this is only twice a week for 3 months. Okay, so it's clear that there's subtle, maybe mild changes, which isn't too bad. You can actually see less, I guess they're called crow's feet. I'm not the expert in it, around the eye. So, obviously there is a positive change. So when they looked at all their study subjects in this particular paper, they objectively measured the data, and there was significant reduction of wrinkles in 36% of the subjects. Also increases in skin elasticity, about 19%, and compared to the baseline. Histologically, they noted a marked increase in the amount of collagen and elastic fibers in all treatment groups, so meaning infrared or red, not the sham. Ultrastructurally, they noticed higher activity of fibroblasts that were surrounded by more abundant elastic and collagen fibers. So that means they were secreting more collagen and elastin. The therapy was well tolerated, no adverse effects, and obviously they concluded that both 830 and 633, or so red and near infrared, was effective to some degree for skin rejuvenation. Another paper, I'm just checking my time here. Another paper, wow, okay, I have to get moving here. Another paper looked at LED treatment of photo-age skin. 13 subjects, they had a specific scale they were looking with, again, using red and infrared light. Again, if you look at patient 1 or patient B, eyes closed, day 1, and then week 12. Note what you're looking at here, just under the eye and out towards, again, to the outer margins of the eye. You can see that there's less wrinkles there. And it's hard to see, but also the skin, the appearance of the skin looks healthier. I don't know if you can tell it in the pictures or not, but it's quite obvious the skin seems more hydrated, seems like it's thicker or fuller, if you know what I mean. Like, hey, I'm a chiropractor here, I'm not a cosmetic guy, but even to me, it looks to me that that's the case. I'm going to try and move along here. Just another case study here, same paper. You can see the forehead, and again, if you look at the post-treatment, you can see a definite improvement overall in the appearance of the forehead wrinkles. So results, they had a moderate success rate in 50% of the subjects, and a slight success rate in 25% with response to the treatment. Treatment of the periorbital region was reported to be more effective than around the nose and the lip region. 12-week follow-up, 91% of the subjects reported improved skin tone, 82% reported enhanced of smoothness of the skin in the treatment area. Okay, so as I mentioned earlier, Dr. Khan, while he's known for his wound care and all sorts of other amazing medical conditions he's treated, he did treat some mainly women, I guess, but probably the men wanted it as well too, for skin rejuvenation. So if you look carefully here, you'll see some of the results. I apologize for the quality of the picture. These are from the archive, so this is going back quite a ways, probably 20 years or so. But you can definitely see a marked improvement, I would say, of the facial wrinkles in this particular subject. These are striae of post-pregnancy, and you can see quite an improvement there as well. And I think this one we always show in the training because it's quite a marked improvement post-pregnancy and striae as well. Okay, so what protocol are you going to use? Well, we do have a standardized dermatological protocol. Some of you may or may not have it. It depends on your geographical area or when you got the software, because regulatory oversight or whatever has changed over the years. But if you need the protocol, I'm going to present it here. So if you look at the protocol, the first step is using the array. Now, in this case, it's a dual 180, you can use a 240. The treatment time is pretty long. For red, it's continuous wave for 12 minutes. So it's important that the skin and you can really focus a lot of this light into the layers of the skin and activate as many of these fibroblasts as possible. And then that shifts, of course, into infrared, 50% duty cycle. So we're talking about 50% of the power. So that's about 750 milliwatts, which is the same as the red. So if I backed up a little bit here, this red is 100% power. That's 750 milliwatts. This infrared at 50% power is also 750 milliwatts. And we're pulsing it out at 50 cycles per second. Now, I'm not going to recommend necessarily using a laser probe for skin rejuvenation because the LEDs are quite effective to be able to target and saturate the epidermis and dermis and hypodermis. So For the most part, at least for photo rejuvenation, you don't really need to use the laser probe. And of course, it's much safer that way as well too. Stage 2 protocol, you can see that the red is now being pulsed out at a much higher frequency, still 12 minutes, 80%, a little bit less energy overall, but we're stimulating it more with a higher pulse rate, okay? And then the infrared, you can see still 12 minutes, increasing the power. So now we increase a little bit more of the infrared, and the frequencies at 50 cycles per second. Okay, I think into stage 3, the first stage you should stick with for quite a ways. And if you're not seeing results after maybe a month or more of treatment, you can shift slowly to stage 2. But don't shift to stage 2 right away. Stage 1 usually works quite well. Remember, even though LEDs technically don't harm the eyes, they're bright and they can irritate the eyes. And I don't want you to use an array around the eyes, even if the eyes are closed. I prefer that you had the patient wear the protective goggles, put on a eye makeup pad, then put the goggle piece on, and that will also be very helpful in protecting all of the light that may irritate. And because we're pulsing the light, in some cases the red light, this also blocks the pulsations into the retina. For people that have seizure disorders, be aware of that, because it can trigger a seizure disorder if it's under 30 hertz. Usually if it's above 30 hertz, it's not a problem, but if the eyes are protected, it shouldn't be a problem either, but that should be part of your history taking as well. Really critical to take pictures. Take the initial picture, high definition, make sure you have the same lighting, the same diopter of the lens and everything set up so you do the same each time, high definition, and take a picture every maybe 6 sessions and monitor the progress. The other tip, again, guys, I'm not the salesperson here. I am just trying to say that if you're treating the face using our regular array, it's fine, but it's a little hard, obviously. It can be a little uncomfortable to some degree. So I would recommend, if you have the newer system, to get one of our flexible arrays, the 180 and 240. And I'm pretty sure we have a special on that that was showing earlier. I'll loop that a little bit later. The special goes until the end of the year. So if you're interested in getting more involved with this type of thing, these silicone arrays, nice and easy and gentle on the skin, a little bit more pliable around the nose and so forth. And actually surface area is quite large, so it can cover the entire forehead or the facial region as well too. Treatment plan, again, as I mentioned earlier, and I know you guys are having questions, that's fine, I'll get to those. Maybe I'll get to those before I move on to the next topic. The consensus, if you look at the research and sort of what we've done and what Dr. Khan has done, is that this rejuvenation type of treatment, you have to be consistent with it. The treatment plan should be laid out over, a fair length of time, a couple months, maybe 3 months, 4 months, to get maximum results, right? Frequency, I mentioned earlier, at least 2-3 times a week, and preferably supplement at home, maybe with a rental system. We offer rental systems. You guys can take advantage of that. There is a return on investment for you guys to do that. Or you can purchase systems to rent out as well. This is the perfect way of doing that, getting extra income. Patients don't have to come in during COVID, the routine, and you're still generating revenue. Have the patients come in for their photos, do all the other stuff that you would do. So there's still a great way of generating revenue, even through rentals or patients purchasing systems as well. Juliana Kulik, our sales manager, you can always reach out to her if you have any questions about that as well. Okay, so let me get to some of the questions that you've had, before I get on to acne. So a question, someone listening in, Joan has the personal system as far as how you should approach that. Joan, I'm going to ask you that to email me separately. I have mentioned it in the past in some of my other webinars, but they're preset in the personal system. So if you reach out to me, I can help you out a little bit about how you might approach using the personal system. And for that matter, any of you out there that want to use a personal system for your patients, the protocols are preset in there. You can't change them up, but there are ones that are similar to the dermatological ways of approaching it. So you can email me and I can help that out as well. A question from Suzanne, were these permanent changes or would this need to be continued with the use of photobiomodulation? So again, when you're looking at skin rejuvenation, they noticed that the effects were lasting a fair length of time, but to me, it would make sense that eventually the skin is going to slowly age again. And as Dr. Ewan mentioned, if you're not taking care of your gut, if you're not helping with extrinsic factors, then it will start to age again, right? Obviously, it's going to age. So I'm going to recommend that once you've reached an optimal result that your patient's happy with, then I would suggest that you do maybe some maintenance treatment, or suggest that in a few months or whatever time frame to start to continue some treatment as well. So to answer your question is, they're not permanent changes, but they are long-lasting changes. I mentioned about sleeping position as an extrinsic factor. I haven't been able, it was mentioned in one of yeah, you're right. It was mentioned in one of those papers. And I tried to learn a little bit more about how that might affect premature aging of your skin, that kind of thing. I think it revolves around when your face is on a pillow. The skin isn't able to properly secrete its oil, and I believe it's because of pressure on the skin with a pillow. But I'm not 100% sure about that. So if someone wants to investigate that and let me know. I think that would be interesting for all of us to know. And then Lorraine had a question about describing the placements on the face and how to secure on the arrays on the face. So it depends on what array that you have. So if you have a smaller, like a 180 array, like if you're doing on one half the face, then literally you just want to make sure the goggles are on. And then you want to cover, usually one array is going to cover over your cheek area, the eye area, and around the area that you're treating the wrinkles. So you have to do 2 placements on either side. Depending on the size of the face in the array, if you have the larger array, you may be able to go around the nose, around the mouth, and actually get most of the area that you want to treat as well. It just depends. The other thing is, make sure you tell the patient that that after the treatment, they'll have little depressions in their skin because of the LEDs protruding out, and that will go away within the hour or so post-treatment. In general, you don't need to, the weight of the array should be easily enough to keep it in position if they're lying prone or on their side. But if they're sitting up, then essentially you probably have to ask them to hold the array in position, would be the best option. But I would suggest relaxed position, lying prone. And of course, for facial wrinkles, one array should cover over the forehead. So hopefully that answers your question as well. Sorry, I'm just looking at a question about overlapping. I wouldn't, so yeah, I mean, we always mention with respect to overlapping of arrays that, you don't want to treat one side of your face and dose that up and then treat the other half of it that's been treated already. And then the other, like you want to make sure there's not too much overlap. A little bit of overlap is fine, but you don't want to treat one area twice in succession, because then the effects won't be as good. There's no harm, but the effects won't be as good. So hopefully that answers your questions. Guys, I'm only looking at the Q&A, not the chat. So if you have questions for me, I'm going to suggest that you type them into the Q&A. I have a question about TMJ, Lorraine. Unfortunately, I don't have time to get TMJ. I do have some webinars on it, Lorraine. Feel free to email me and I can send you those out for sure. So I did mention about not using the laser probe, and that's really because the dosaging is adequate for skin rejuvenation using the array. Okay. All right. So let me move on to acne. If you have some other questions, you can email me, or maybe I can get to them at the end as well. Now, what I'm going to do right now with acne is just talk a bit about its etiology, some of the research. I'm going to leave it to Slava, who's coming up next, to do some case studies and some of the customization protocols for that. So as Dr. Ewan mentioned, there's different ways of understanding how acne, what causes acne, right? Some of the factors as well that cause it. We do know that the acne vulgaris, which is the name given for the typical acne you think of, it's a very common disorder. Obviously, actually, they say that 100% of all adolescents have some form of comedone. A comedone, I don't know. I think it's comedone. I tried to look at a few ways of pronunciations, or this acne papule. Almost every kid, you're going to see probably at least one or two or small ones. But actual acne vulgaris, where there's an outbreak, that can be up to 90% of the population of adolescents. So, it's a problem. We all know that, right? Been there, done that. Or maybe still get the odd pimple or whatever, right? But that's a comedone. That's a specific, small nodule or whatever, not a acne vulgaris where there's an inflammation and a breakout kind of scenario. But the overall pathogenesis, as Dr. Ewan mentioned, is still not really completely understood. And that's because of effects like the gut and diet and all these other things as well. But they're still thinking that there's some major events going on: hyperkeratinization, increased oils or sebum production, colonization of specific bacteria, Propionibacterium acnes. Dr. Ewan, I think, mentioned another culprit as well. And these feast on triglycerides, and then they release cytokines, which are inflammatory agents, and then cause infundibular keratinization around the skin, around the hair follicle. It narrows it down, reducing blood supply. So there's lots of issues that are potentially going on. And of course, there's inflammation, which is why photobiomodulation can be so effective in treating acne. Lots of different therapeutic options that people try, topical antibiotics, retinoids, benzoyl peroxides, AHA, salicylic acid, blah, blah, blah. Lots of acids, right? Boy, it just, isn't that great? Throw some acid on your face and see if it kills the acne. However, of course, there's even in severe cases, they will prescribe some nasty antibiotics and oral retinoids and even hormonal treatment in really severe cases. And these medications, for the most part, try to counteract the formation of these small comedones from forming, and excessive sebum production and reduction of the bacteria and inflammation. That's kind of what they're trying to do with these drugs and treatments. Now, this is where diet is interesting. I did a lot of research for this, and as Dr. Ewan mentioned, the standard North American, I wouldn't even say North American now, to be honest, Dr. Ewan, I would say worldwide diet. I mean, it's hard pressed now. You go to Japan, you go to China, you go to Brazil, you go wherever, South Africa, you're inundated with westernized, food, right? High sodium, addictive, sugar. I mean, all that kind of stuff. And what they found, for the most part, is a low glycemic load diet is recommended for acne patients. And someone mentioned earlier about a Paleolithic, I think I'm saying that right, diet. So low carb, basically, maybe more meat or whatever, or protein. I personally would prefer minimal meat, more protein through legumes and that kind of thing, which also increases fiber as well, to be a really good diet to help reduce acne as well. Chocolate, dairy, dark chocolate isn't nearly as bad as milk chocolate. So I think you're okay to snack on some dark chocolate, but avoid the dairy products Dairy is implicated with uh, increased lipid secretion and production by sebaceous glands. So again, low glycemic, low diet, no milk, in populations around the world that have little or no acne, that's the kind of food they're eating, right? Not the westernized diet that we're all addicted to. Also consumption of foods rich in omega-3s, linoleic acid can also have a therapeutic effect. I'm not the nutrition expert at all, but this is just what I found when I did some of my research. Light effects on the skin can be very profound for acne. Slava will be doing some case studies to show our results. I'll show you some of the research as well too. So, blue light comes about quite frequently as well, and we don't use blue light. And to be honest, it's in the works. So, but red is still extremely effective and can do more than blue. And I'll explain why shortly. So what we found with research and case studies and clinical trials for acne is that one of the mechanisms is that the bacteria produce porphyrins. And porphyrins are a complex kind of, it's a complex compound. They link to metals. And this is part of the normal metabolism secretion of these bacteria. So these porphyrins are inside, not secreting, I did say secretion, they're inside the bacteria, okay? Now porphyrins react to light. And what happens is when the light of these certain wavelengths hit the porphyrins, it releases free radicals and singlet oxygen species, which is a fancy way of saying free radicals that just completely annihilate the bacteria from the inside out and kill it. So when you irradiate these cells with the red light or blue light, but I'm going to focus on red light and even infrared light, but red light's better because red light accumulates on the surface of the skin much more profoundly than infrared. And so it becomes toxic. So if you really saturate the bacteria on the surface of the skin, then you can actually turn these porphyrins into little ticking time bombs that end up destroying the pathogen that leads to some of this inflammation and the cause of acne. So again, red light has a deeper penetration. I'm getting ahead of myself, but I already mentioned that. Infrared's going to go a little bit deeper. But they also found, interesting enough, that infrared can have a negative effect on sebaceous glands. By that, I mean, when sebaceous glands are overproducing and overactive, it modulates the cell cycle to become more normal. That's the crazy thing about photobiomodulation. It takes cells that are doing something weird and accelerating, doing something too much, it can normalize it. And that's what infrared seems to do to sebaceous glands. That's another mechanism of how it may be very helpful. Red light's also believed to stimulate cytokine release from various cells, including macrophages. These are the positive anti-inflammatory cytokines, not the pro-inflammatory cytokines, including macrophages in the skin, and this can help reduce inflammation. Okay, so there's some research out there. This particular paper was published, I think it was 2009. They looked at patients with mild to moderate acne vulgaris. They used red and infrared on the right and left sides of the face. They only treated twice a week, 12 sessions, and they were assessed both at baseline in weeks 2, 4, 6, and 8. And then you can see an example of the results at 6 weeks and 10 weeks. So we're looking at a fairly good reduction of the acne vulgaris in this particular patient, for example. So in the results, what they posted was 10 weeks after treatment, acne lesions were significantly decreased, especially by the red. But that significance, that decrease in acne was not as observable just using infrared alone, which speaks to the fact the infrared light is more effective at going deeper to layers of the skin. So then why would we use red and infrared? And that's really because the infrared will have more of an effect at the deeper levels of the skin and the blood circulation at those levels, helping with inflammation as well. But it doesn't have enough powerful effect enough on the bacteria to have noticed much of a difference in this particular study. Again, when you're treating with BioFlex for acne, wear those protective goggles. No, not you, the clinician doing the treatment, the patient wearing the goggles and the eye makeup pad. Take high definition pictures, as I mentioned earlier.
Good morning, everyone, and happy Saturday. Thank you for joining us for this event. And right away, I would like to thank previous speakers, Dr. Ben Ewan and Dr. Konashka, for doing an excellent job in making my life easier, explaining all of the details and covering those very important aspects related to the anatomy of the skin, all of the layers, cellular molecular components, pathogenesis, pathophysiology involved, because all of those factors are truly, truly important to consider when treating patients with a variety of conditions that we'll be discussing later today. So, factors affecting the skin. Obviously, there are a few, and Dr. Ewan already mentioned, and Dr. Konashko. Environmental. We live in a 21st century, and especially during the COVID pandemic, we have noticed the use of chemicals, sanitizers, cleaning ingredients has increased tremendously. That is why we hear a lot coming from patients' complaints regarding contact dermatitis, allergic dermatitis. Sometimes it's called even atopic dermatitis. And that is why also it is extremely important to take that into consideration, especially when we're trying to identify the source, the trigger to eliminate before initiating the healing process. Nutritional and GI tract related. So once again, thanks to Ben Ewan, now we know more about that. And indeed, if we're trying to effectively help our patients to resolve the problem in the long term, those problems should be addressed. And I'm going to touch on that, what kind of particular recommendations we provide our patients. Allergies also, we see increase in numbers, not only seasonal, but also environmental, food-related allergies that also trigger a variety of skin conditions, even in a younger population that previously have not been affected. Viral, bacterial, fungal infections. In some of those pictures that I'll be showing to you, you will see these infectious agents present as a factor contributing to worsening or even developing complications secondary to the primary skin condition. Well, obviously, aging slows down metabolic and regenerative repair abilities of the body to deal with those kind of issues, especially if we're talking about systemic problems. Trauma to the skin, this could be not just mechanical trauma due to some, let's say, profession-related hazards, let's say construction workers we've been treating in the past, those who spend a lot of time outdoors, but something simple just like these seasonal changes, the air temperature, weather conditions. Now we're entering the winter season and the dry air everywhere will be in residential spaces, in office spaces, and I can feel it even with my own skin that now it's time for my air humidifier to be activated. Metabolic, hormonal, lifestyle related factors. Every time I would see somebody who's suffering from chronic skin condition, and it would be so obvious to notice that some of those patients would have already pre-existing conditions involving excessive weight, maybe even diabetes, metabolic disorders, hormonal issues related to thyroid matters, or something that would be occurring in a premenopausal, postmenopausal age. And that is why dermatologists and medical professionals in general are often at a loss to diagnose many conditions. So that is why we see sometimes very indefinite and unclear diagnosis when patients come to our clinic. So other etiological factors often beyond the scope of diagnosticians, and to be honest, not many tests would be available to identify specifically or to establish an accurate diagnosis. So that is why whatever inflammatory condition that would be, it is simply called as dermatitis. So what is the conventional mainstream medicine kind of approach? Usually it involves oral and topical medications, okay? And unfortunately, overuse of those topical creams, especially with steroids, create more problems, inviting secondary infection, and then it becomes more and more difficult to manage, causing metabolic disbalances inside and outside. Use and overuse of antibiotics, again, this may lead to dysbacteriosis, affecting the microbiome, and that will become more like a vicious cycle. Okay, antifungals, those are very toxic medications, as we all know, and that is why patients who have tried them eventually would have some other health issues related to inflammatory conditions in the joints or GI tract, liver, kidney related issues. So these often not the combination of these kind of pharmaceutical and topical approaches not deliver always the desirable effects. That is why patients take the initiative to investigate, to educate themselves, and to seek something more effective and safe at the same time. Now, what is our approach at Meditech Rehabilitation when it comes to dermatological problems? On an individual basis, obviously, once we see the patient, do our own assessment, evaluation, discuss all of the factors involved, and then we develop a treatment formula, as we call it, therapeutic formula. If we know that patients have been using those pharmaceuticals or topical creams for a long period of time, especially utilizing some dressings, applying those ingredients for a long time, we recommend to stop doing that. And in most of cases, patients say, oh, I hate just doing this, and I've realized after months and months of following these recommendations or using this and this medicine, I am not seeing the results what I would be expecting. And then in the following 2 or 3 laser treatments, once they see with their own eyes the changes, the positive response, it becomes more and more evident to patients themselves that this is the right way to go. This is the right direction that they're picking with photobiomodulation. And the beauty of applying laser therapy for skin conditions is that it's literally happening, all of this transformation, healing, reduction in inflammation in front of your eyes. So that is why it's easy to see, to document, to observe, to measure. So without any exaggeration, 90+% of all skin lesions would be completely resolved after administration of laser therapy in a matter of 10, 12 treatment sessions. Obviously, after many months and years sometimes of suffering from those issues, every patient is expecting some sort of miraculous healing, to see immediate results. And with skin conditions, just like it happens with wounds, it is indeed happening. So that is why we strongly believe that laser therapy is a very safe, effective approach when it comes to those skin problems. I would like to mention, because I've seen some questions regarding the application of laser probe, but I would like to introduce to some of our BioFlex customers specifically a red laser probe for reasons now we know from research, because most of the time we don't have to deliver a lot of energy to a deeper layers of tissues, because all of it would be in a matter of 3 to 5 millimeters, so to speak. And red laser probe can help us to achieve the stimulatory, the healing effect without overdosing it. So that is why those of you who do not have it, or perhaps you have just a standard BioFlex system with arrays and infrared laser probe 200, I would suggest to look into this laser probe, because it will be very useful to you, not just for skin conditions, but also for wound healing, for soft tissue repair, stimulation, And I know that some practitioners use red laser probe for laser acupuncture, let's say for some other symptom relief purposes. Now, most of you are familiar with main clinical effects of laser therapy when it comes to fundamentals, okay? But today, obviously, we're gonna zoom in and talk more about skin-related issues. So David already mentioned to us macrophages and neutrophils. They remove damaged cells, breaking the cycle of chronic inflammation. Then oxidative stress will be reduced by promoting cell survival and reducing cellular damage. Anti-inflammatory cytokines and reduction in pro-inflammatory cytokines will prevent stalling in the inflammatory phase, promoting tissue repair. This is very important, like I said, in the healing and the treatment of chronic conditions, such as like psoriasis, for example. When we see those patients, you will see fresh, old, and somewhat in between stages of inflammatory process, obviously with some skin transformation and keratosis, even patches. And this is when it is extremely important to take that into consideration. That is why red and infrared lights helping us to achieve our therapeutic goals. Prostaglandin reduction levels will reduce pain and decrease vasodilation and edema. Also, I would like to mention the importance of this particular aspect when it comes to skin conditions affecting the entire skin surface. Let's say some aggressive dermatitis, patients suffering day and night, 24/7, a lot of itching, burning involved, sometimes uncontrollable. And this just adds up more to the agony when they suffer from those skin problems. Additional patient directives in home care. On day one, once we complete our full examination assessment, and then we discuss in more detail our treatment strategy, we stress those particular points. Why? Because there is only that much we can do with our laser technology when it comes to applications and achieving our healing goals externally. But then we invite patients to be part of this solution by changing their lifestyle, by addressing, identifying, and eliminating those possible environmental allergens, chemicals, endogenous triggers. You would be surprised how many patients we came across who would be eventually diagnosed with some endogenous toxins coming from parasites or dysbacteriosis as the result of ongoing antibiotic therapy. Plus, these days, many people suffer from food intolerances and allergies, not even knowing about that. Other enzyme deficiencies, this can be also age-related and metabolic-related enzyme deficiencies that can be triggering and contributing to the manifestation of skin lesions. So this list can go on and on and on and on. Also, I can recall a few patients, because you cannot forget their faces and their bodies with those skin lesions, especially after undergoing aggressive therapies due to cancer, surgeries, followed by radiation therapy, followed by chemotherapy, with immunodepression, some of them receiving immunodepressants, let's say after some organ transplant surgeries. They also would be suffering from skin conditions. Detoxification. By all means, I'm not expert in this field, and that is why I always invite into this conversation, into treatment plan, those professionals in healthcare who would have more knowledge and would be equipped better than us. I'm talking about naturopaths, I'm talking about nutritionists, and I've noticed, and I'm happy to see that Yasmin is joining us. I hope also our good friend Sean listening to this, or maybe will have access to these presentations. It is extremely important to help patients to go through this stage of detoxification so that the healing would be happening, because laser works so much better and faster on healthy cells, on healthy tissues. And once we're going to help to clean the body from inside, all of those beautiful transformations on the outside will be happening. Anti-inflammatory diet. I see more and more patients actually who would be serious about helping themselves, switching to that anti-inflammatory diet, especially when it comes to gluten-free diet. And I'm talking about patients with acne, with psoriasis in particular. You can see changes right away. And some of those pictures I'll be showing you later, you can see it without even knowing the particulars of individuals' lifestyle, their dietary habits, their preferences. You will notice that. Definitely, there is a benefit of integrating vitamins such as vitamin A, B2, vitamin D, vitamin E to reduce that stress, oxidative stress, but also to promote healthy skin. Integration of prebiotics and probiotics that will help to reestablish and normalize healthy gut flora, microbiome, and then supplements such as omega-3, coenzyme Q10, magnesium, and zinc. Proper and adequate hydration. Very often patients wouldn't be even aware of the fact that we're talking about the skin as the largest organ in human body. So once again, thank you, Dr. Ewan, for opening your introductory lecture with this very important fact. And our skin, this organ, has to be hydrated properly, especially during the winter time and during the summertime if the individual is exposed to overheating. This will be also helping us to achieve our goals with detoxification, reducing inflammatory stress, okay? Maintenance care. When it comes to maintenance care, but also ongoing skin care, okay? Basic elements related to hygiene. Sometimes I see the desperation, I see a lot of pleas, so to speak, to help with such and such problem. But they see absolutely no interest in helping themselves when people just ignore, do not apply basic hygiene rules and principles. So when it comes to overuse of topical creams, lotions, compressing with warm saline solution, or even warm water baths for hands or feet, or maybe even the entire body would be necessary. So this will help to achieve quite a few therapeutic goals even. It's a gentle way of removing all the dead skin. And I will not at this point in time even mention things like exfoliation or dermablation, because we're talking about medical skin conditions such as psoriasis, eczema, etc. The application of daily skin moisturizing products to preserve, to nourish, to protect the new skin cells that will be forming and appearing in the treatment zone, preferably without any chemicals involved, fragrances, any other ingredients that may in a negative way affect the skin. And if patient requires continuous treatment, so commuting to the laser clinic is a factor, because we receive numerous inquiries from outside of Toronto, outside of the province, even outside of Canada, then we recommend switching to the use of a portable system. And this could be a rental system, which we can program by uploading customized, personalized prescriptions, the ones that we've been using on the patient while receiving treatments at the clinic, or the use of a personal system like P120 or P180. Once again, in the past almost 2 years of pandemic, we've had to rely more on portable system use because, well, we all know restrictions and difficulties associated with this. So that is why I can tell you honestly, thank God for those portable devices and the opportunity to help patients in a such way. Otherwise, it would be difficult for all of us, patients and practitioners, to do something about it. Now, let's go over some specific conditions and cases. Eczema will be the first one, followed by psoriasis. I'm going to talk about acne, and then some other skin lesions, such as herpes, two types, herpes simplex and herpes zoster. Then we're going to touch on warts a little bit, and some others maybe, if we have any time left. Psoriasis. So beginning with the definition, exacerbations and remissions associated with this common chronic squamous dermatosis. So indeed, there is a known fact that can be inherited but at the same time, characteristics of psoriasis involving microabscesses in different forms, spongiform pustules, histologically distinctive and well-developed psoriasis. And it could be varying from just patches, distinct patches, let's say in elbows, like externally, or behind the knees, or even covering the entire surface area, as we say, from head to toes. Predominant on extensor surfaces, nails, scalps, inguinal, lumbosacral regions, could be rounded, could be circumscribed, different in colors depending on variety of stage of inflammation, also in different degree of dryness, most of the time showing some scaling patches. Grayish white, again, the range can be from grayish white to silvery white to angry red patches. So that is why configurations can be really different, and that is why it's sometimes difficult even to diagnose psoriasis. It affects 125 million people worldwide, which is 2 to 3% of all total population. 10 to 30% of people with psoriasis also develop psoriatic arthritis. So that is why it is so important to treat psoriasis itself effectively, aggressively. And 1 in 4 people with psoriasis have cases that are considered moderate to severe, which is quite a significant number of population. And total direct and indirect healthcare costs of psoriasis, you can see 11.25 billion annually, with the workforce accounting for 40% of the cost. I'm presenting the first case, 62-year-old male with a history of psoriasis for more than 10 years. And ironically enough, he's been referred to our laser clinic by his daughter, who is a naturopathic doctor. And when she called me personally, she said, Slava, I'm sending you my dad because honestly, I don't know what else to do or what else to apply or what else can I do in my practice, because I have tried everything, adjusting his diet, doing certain tests, trying different remedies, natural products. We are not moving forward. We're kind of stalling. So this was kind of first learning case for her as well, as she was just about to enter the world of laser therapy. And I said, well, we'll be more than happy to help your dad, but also educate you on the BioFlex laser therapy. And as you can see, the tissue transformation, the healing started happening almost immediately. And after 2 months of laser therapy applications, the lesion itself has healed totally. There were any signs of any inflammation present. But then even metabolic changes have been achieved. And thanks to this 62-year young man, actually, with our combined joint efforts, this case was closed successfully. And to make a long story short, he became a certified laser therapist working for his daughter, applying BioFlex laser therapy in her office. This 55-year-old man, who happened to be a personal friend of mine, whom I've known for now close to 20 years. And he's been suffering from psoriasis during previous 15 years throughout our friendship. So how many medications and topical creams he has tried, I've lost count. And he was also selected for an experimental study conducted at one of the hospitals in downtown Toronto, U of T network. So they have tried injectables. He received 5 of them at a cost of $2,000 each injection. And unfortunately, noticed no results whatsoever. So we've started, just like I mentioned previously, with basics, explaining the importance, the significance of changing everything in his lifestyle, eliminating all of those triggers that could be contributing to this. And it was an easy thing to do to identify. First of all, cigarette smoking. Secondly, alcohol consumption. Then he loved good food, and in terms of calories, wouldn't even care. So his meals will be always rich in calories and fat, pizzas involved, burgers involved, etc., etc. And if you will take a closer look at pictures on your left, you see some suntan, because he's been trying again and again the use of UV lights. But also what we see, some excessive adipose tissue under that skin. So we see this, as we call it, muffin top, right? Unfortunately, this chronic condition also took a toll on his emotional and psychological health. So he was sliding into depression, and we had to address that issue as well. So anyways, he was doing his job at home, and we initiated our laser therapy work with him. So we're looking at these pictures in the middle after 3 months of aggressive treatments. And I'm showing you only his torso area, because psoriatic lesions were covering everything: his face, neck, upper extremities, lower extremities. So now we can clearly see how the skin started clearing, and we see that the most, even aggressively, the most seriously damaged areas started being replaced with healthy, rejuvenated skin. And these 3 pictures on your right, you can see, took him quite a few months to achieve that he lost weight significantly due to his healthier diet. He became leaner, he became healthier, metabolically more active, exercising, started traveling, going vacations. So what was happening in between? I've explained to him that we will not be physically able to cover all of his body parts, okay? And that is why we have prioritized our treatment targeted areas. So going after torso area. And after 10 laser treatments at the clinic, I've introduced him to the use of a portable rental system. So this would save the cost of care, but also it will offload my clinical operations, because I would have to use 4 systems at the same time to maximize the efficacy. And we've switched him to the rental system. After 3 months, when he came for those pictures to be taken at the clinic, he said, you know, Slava, I think it would be better for me even to buy my own system. So the rest of the healing work was done pretty much by the patient himself at home with the use of a personal system. Under our supervision, we'll be seeing him for reassessments, reevaluations, some intensity adjustments. And for the past few years now, the situation is totally under control. He's quite happy, and he never looked back to any steroids or any pharmaceutical medications options. Psoriasis, psoriasis affecting digits, both hands. And pictures on the left, you can see patient was already at the initial state of developing psoriatic arthritis. So here is a combination of psoriatic corrosion of fingernails, skin that is currently inflamed on those pictures on the left, as we can see, and also painful stiff joints in smaller interphalangeal joints in both hands bilateral. So also we can see progression, quite a positive response to the treatment, and eventually with the initiation of new healthier fingernails growth, all of those corroded, deformed nails have been replaced completely, totally, naturally. Here we're looking at more acutely inflamed case of psoriasis. And you see how in a matter of 2 treatment sessions, those patients would be coming to the laser clinic at early stage, you would see how they respond much faster. And this is a big difference between treating somebody with a long history and chronic and longer lasting skin transformation versus more fresh, more acute, more recent episodes. It's easier to stop the disease from progression. It's easier to change the course of events right away. Now, speaking about treatment protocols, okay, so this is something that we have developed, and we've been using this as a standard platform for laser therapy applications. So no matter what type of BioFlex system that will be, I would suggest to adhere always to begin with these kind of settings. And let me bring to your attention, first of all, the duration of application. As you can see, with the red light, 5 minutes per placement, with the infrared light, 6 minutes. And you see lowest settings, frequency 10, duty cycle 50%, with the use of laser probes of both types, infrared and red laser probe. What we see here, continuous wave, but at a 50% reduced power. David already mentioned earlier, we don't need a lot of power. So that is why even within 6 minutes in total duration of application for laser probe, all it takes just about 2-3 seconds per spot. And again, when we apply laser probe randomly over those lesions, we don't spend much time. The idea is just to deliver that stimulatory dose, 2-3 seconds per area. Stage 2, intensity, switching the red light from continuous to modulation with the square wave, frequency 100%, and duty cycle, again, I give you the range when you can manually make those customization changes from 60% to 70 to 80 up to 90%. And on the infrared light, 50-50, but then even within this stage 2 intensity level, we can incrementally increase to 60, 70, and 80%. And laser probes, once again, with the infrared laser probe, it delivers a lot of energy. So 80% will be very adequate, and red laser probe at full power. At level stage 3, because some of those patients, just like the one I've mentioned earlier, would require a few months of treatments. At some point in time, you would have to make those changes to intensity. So red light frequency 1000, duty cycle 90, on infrared 250-80, duration stays the same, and laser probe 200 with full power at 100%. Eczema. Pruritic papular vesicular inflammation of the skin as a result of various endogenous and exogenous agents. Fissuring and punctuate hemorrhages may develop. Indeed, because it is accompanied by severe itching and burning, and sometimes even it's self-aggravated, making things even more difficult to treat. At its acute stage is defined as erythema, edema associated with exudate between epidermal cells and inflammatory infiltrate in the dermis. Approximately 10 to 20% of the world population affected by this chronic relapsing and very itchy rash at some point. Prevalence in Canada is higher than worldwide and present as dry, itchy skin on the following places like scalp, face, neck, back of the arms, front of the legs, torso, technically within skin lines and creases of elbows, behind the knees, in groin area, and is closely related to asthma and hay fever because there is always some allergic component involved. Other characteristics include fluid discharge, vesiculation, crusting, and scaling, okay, thickening of the skin, which is called lichenification, excoriations, and hyperpigmentations, which will indicate on a chronic state of eczema. Hyperpigmentation findings associated, especially in chronic patients. And most common eczema type is atopic dermatitis of allergic origin. So here is an example, a 50-year-old male with specifically allergic type of eczema. And actually, these type of cases have become, like I said, more and more common in the past few months due to increased use of hand sanitizers and other chemicals for disinfection purposes. So we see acutely inflamed rash affecting palmar and dorsal aspects of both hands. Intermediate pictures showing us how that acute inflammation is truly reduced. Tissue is now looking calm, and we see how this borderline between healthy skin and affected skin is now becoming smoother. And then the final picture showing us complete resolution. Once again, when it comes to allergic dermatitis, it is extremely important to identify, to make an effort at least to identify the trigger, the allergen, to prevent further flare-ups in the future. And this is just a close-up picture. Once again, you can see the skin transformation and the healing happening, regeneration, where eventually all of those pigmentation sites will be replaced with a healthy skin. 32-year-old female who happened to be a massage therapist. She developed this type of eczema, more allergic dermatitis as well. She happened to be sensitive to all of those massage oils that she's been using on her patients. And that was quite bothering to her, but also affecting her professional practice, in addition to mechanical irritation, mechanical trauma when she would be applying her hands during those massage sessions. Nevertheless, she responded quite well to the treatment, and also going through some natural products to incorporate as a form of massage oil lubrication has helped tremendously. Another 32-year-old female with eczema affecting forearms, and you see traces from scratching, okay, also pigmentation, dry skin, okay, also showing as a result of chronic inflammation some signs of even aging skin. And after 5 treatments, the acute state of inflammation was under control. We see already new fresh skin formation on these pictures. And also, if you compare these 2 areas in the wrist region, you will notice that indeed the skin is looking younger. 24-year-old female with eczema of allergic type, quite severe, quite aggressive. Okay, we're also looking at those lesions. Again, she was the one who was suffering day and night. And as we all know, a lack of sleep actually is contributing to more pain, to more inflammation, to more irritation. Not to mention, it takes a psychological toll on patients. And then again, it's becoming more like a vicious cycle, one issue contributing to another one. So laser therapy was helping us to achieve few goals, helping us to reduce systemic inflammation, but also through endorphin release, improving the quality of the night sleep, at the same time doing the healing work on the surface of the skin. 40-year-old female, okay, with extreme irritation, suffering for 5 years, and but rapid response, again, rapid response, just in a matter of 2 treatment sessions. Obviously, after those 2 treatment sessions, we have continued with laser therapy. Cases like this, 48-year-old male, you can't forget really. Eventually we became good friends with this patient. He's been suffering from this skin condition for more than 15 years. Plus another issue, another challenge was geographical factor involved, as he still lives in Muskoka area, which is more than 2 hours to drive north of Toronto. And this man, you have to give him a big credit, made a lot of efforts to change everything. His diet, lifestyle, detergent, laundry, softness, like switching totally to different type of fabrics, underwear. Like the amount of work, research and self-education he has done was really impressive. And I have to tell you honestly, I'm learning a lot, sometimes even from patients themselves, because they tell me about some innovations or some particulars of their conditions that I wouldn't even know prior to those kind of challenging cases treatments. So nevertheless, few treatments have been done at the clinic, and he was convinced that indeed laser therapy is the right way to go. And then he continued with the use of a portable rental system. So everything was cleared, healed. I haven't seen him now for a few years, specifically for skin condition, because he was coming then for his shoulder problem, some knee issues, etc. And this patient, 22 years old, female, she happened to be working for us, for Meditech International company. So one day she said, Slava, I've listened to your presentation during the certification training, and in fact, I have my own skin problem. Can you help me? Absolutely, yes. So we gave you 6 treatments, and she was quite happy with the results. And then a year later, we just took pictures just to see how are things. And she did not have any recurrence. Again, under one condition, eliminating triggers, identifying what was initially causing that type of skin reaction. It helps tremendously to define the future course of normal health. 13-year-old boy who happened to be a son of my good friend as well. So this boy was very, very physically active, very athletic, playing hockey, wrestling, judo, playing soccer during the summertime. And he happened to be sensitive, extremely sensitive, hypersensitive to his own body sweats. So this is when saline compressors, this is when even warm saltwater baths would be recommended to, first of all, to remove all of that debris gently, nicely. If you're going to look at these pictures in the middle, okay, you might think there could be some, scab formation or maybe some scaling. No, in fact, those are the fabric fibers from his knee pads from hockey. And this is when gently you have to preserve the new healthy skin formation, but at the same time to get rid of all of the debris from the area. So that is why saline compressing warm water is the best solution for that. Not to mention, bacteria usually is very unfriendly. They are afraid of salt water, especially with the high concentration exceeding 2% solution. But as we all know, it's the most safest, non-toxic, and non-allergic way to deal with these type of scenarios. And then laser therapy does what it's supposed to do, the actual healing. So it took 12 treatment sessions to achieve complete healing, resolution, and I haven't seen these kids since then. Stage 1. So this is recommended treatment protocol for customization for you. Again, beginning with red light, 50-50, infrared 10-40, as you can see, low settings, short durations on the red light 5 minutes, infrared 6 minutes. And here we're using only the infrared laser probe. Now, please take a look. It is not with continuous wave. It is modulated with the frequency 100 duty cycle 80, but the power output is significantly reduced down to 30% for 6 minutes. Once again, this is just for random scanning type of applications, maybe 2-3 seconds per spot per application, working over the most affected, the most damaged skin patches. Stage 2 level intensity, red light now with modulation 190, infrared 50-80, and laser probe with continuous wave at 80% power. Stage 3 level intensity, red light continuous wave, infrared 250-80, and laser probe continuous wave at full power, 100%. So this type of intensity level we'll be using already at the final phase, when inflammation is totally under control, when we do not see any sign of erythema involved. So this is technically reaching the finish line where the skin remodeling is happening, where the collagen formation is happening, where all of those aesthetic and desirable aesthetic and cosmetic outcomes can be seen and detected on the surface. Herpes. The virus presents in many forms, including herpes zoster and herpes simplex, indeed. And in all cases, it is an inflammatory skin. That's the manifestation. If patients would not see those skin lesions, they would never even know that they have contracted herpes zoster, herpes simplex. So symptoms include fatigue, sensitivity to the touch, often localized on one side of the body, affecting specific dermatome. Virus often becomes active under conditions of stress, lack of sleep, during the cold time of the year, immune suppression, systemic illness. Virus is responsible for a number of infections in humans, including herpes labialis, stomatitis, pharyngitis. And there are two types of herpes simplex. Type 1, which is usually involving recurrent oral lesions on the lips, and type 2, involving the anal or genital areas. And the worldwide rate of herpes simplex is in between 65 to 90% of the population. It's very contagious, and unfortunately, it stays with people for the rest of their lives, technically maintaining and can be traced in the blood circulation. Majority of cases are undiagnosed or asymptomatic for that reason. So in this situation, when the immune system is quite strong, non-compromised, people wouldn't be even aware that they actually carry virus in them. 20-year-old young man suffering from chronic and often episodes of herpes simplex. So he came to the clinic saying, well, now it happened once again, but very severe. It bothers me a lot. So can laser help me? And he's been familiar with the laser therapy before because we treated him for the variety of sports injuries. Okay, so that is why he came immediately, pretty much soon after those lesions have appeared. So fever, chills, fatigue, local irritation, and lesions like this we'll be treating on a daily basis, obviously, one after another. Within 4 treatments, we have achieved pretty much 80% overall improvement, okay, in terms of symptom modulation, but also crestation of those lesions. And then 10 treatments in total. He was asymptomatic, happy, satisfied, and discharged. 28-year-old female, pretty much same history. Her main complaint was that herpes simplex would happen too often and quite aggressively, affecting both lips, upper lip and the lower lip. And that will be affecting her eating, drinking, even talking. Okay, so again, daily treatments right away. These 3 pictures, they've been taken in the first week of treatments, after 2 and after 3 treatments. 38-year-old female, you can see quite angry, red, aggressive lesions affecting her entire upper lip. And also there were some lesions even on the inside of the mucus. I was able to take that picture effectively. But after 2 treatments, you can see a much happier face, even with the lipstick, indicating on the patient's satisfaction. And I believe even a different hairstyle. She got a new haircut. So in other case of herpes simplex, same thing, same symptoms, quite big, affecting both lips in the peri-mouth area, consecutive treatments, and final conclusion, clearance. What's important also to mention when it comes to herpes simplex treatments, that laser therapy not only promotes healing of lesions, but also increases the duration between herpetic outbreaks. And in some patients, again, if they will be able to maintain healthy lifestyle and sleep adequate a number of hours and take supplements, so this would be preparing their immune system for, let's say, for the winter season or any other unforeseen stress-related conditions. So studies available, publications available on this subject. Indeed, laser helps to achieve healing, but also immunomodulation in those patients. Prescriptions. It's quite simple prescription because 1 placement will be required only. So for the red light, 6 minutes, 50-50. On the infrared light, 10-30 for 8 minutes. And both laser probes, 3 minutes each, just for some touch-ups, as we say, with continuous wave at reduced power initially by 50% on both of them, infrared and red laser probes. Stage 2 intensity, same duration, red light with the continuous wave, infrared 20-40, laser probe to 180% power, and a red laser probe with continuous wave full power. Herpes zoster, also known as shingles, is the result of the reactivation of the virus that causes chickenpox. Following an episode of chickenpox, varicella zoster virus then recedes in its dormant form within the body, neural pathways. In conditions of stress or depression, immunodepression would reactivate this virus. So that is why it's present at the site of the lesion and it's contagious for several days after blisters develop. So optic nerve may be sometimes even affected and can lead to corneal scarring in a little bit less than 25% of cases. So in Canada, 1 out of every 3 people will develop shingles in their lifetimes. And it's true, we see patients with shingles periodically. Most of them would be in their senior years, those who either would forget or would ignore the recommendation of the family practice doctors to have vaccination for that. Worldwide, the incidence rate ranges from 1.2 to 3.4 per 1,000 persons, increasing in people over the age of 65. And then pain accompanies the shingles rash in 60 to 90% of individuals and occurs in 90% of persons with shingles who are older than 60. Indeed, if it wouldn't be for symptoms associated with shingles like pain, burning, itching, not many patients would be even going to clinics or seeking help. 40% of patients with shingles who do not take an antiviral therapy, approximately 20% who do, start to experience post-herpetic neuralgia around 6 months after diagnosis. And that is why my simple message to patients who would have shingles or even healthcare practitioners, please start laser therapy as soon as you see those shingles, as soon as you have access to the patient. Because if you'll be healing, treating acute episode of shingles aggressively, you will spare that patient from developing post-herpetic neuralgia, which is also a very unpleasant, very painful condition. So post-herpetic neuralgia is a major complication, and it is accompanied by severe pain lasting for prolonged period of times, and it's resistant to conventional therapies, difficult to perform daily activities, accompanied by also fatigue, disrupted sleep, depression, and prevalence of post-herpetic neuralgia in the United States is 500,000 up to 1 million cases annually. So here's a case of acute shingles. And I was taking those pictures in a such way so that we could see the spread of those skin lesions beginning from lumbosacral region and then following dermatome from the posterior aspect into lateral aspect of the torso into the abdominal area. And then we see the progression in response to laser therapy. So what's happening, there is some sort of scabbing, scaling of affected dead skin. Again, we don't do anything aggressively. We preserve that skin, allowing the new healthy skin going from underneath just to push it away, out of the way. And then the final picture showing us complete resolution with just residual pigmentation left, just reminding us of those traces where original lesions have happened. Similar kind of case, a 72-year-old patient with a history of cancer disease in the past. So that is why, unfortunately, with immunosuppressive kind of state, at some point in time, he developed this acute episode of shingles, very painful, quite agonizing, preventing him from even wearing normal clothing. All of those areas are very sensitive to the touch and any kind of irritation. Sometimes patients say, you can't even blow the air. It's so painful. So that is why when treated in early stage of inflammation, you can achieve the best possible outcomes. And another case, some of you perhaps have seen these pictures during your basic training with us. Again, initial picture showing acutely inflamed vesicles. This is the most contagious stage of shingles because they filled with all of that liquid. If they're going to burst, obviously the person who will be attending will be contracting it as well. So please exercise precaution, use infection control measures. You can cover the entire surface area before the treatment with the plastic saran wrap before application of treatment arrays and laser probe applications. And then we see how the healing is happening, reduction in erythema, scaling, scabbing process, and then some residual pigmentation that eventually also can be resolved successfully. Treatments. Stage 1, level intensity. Once again, even though we're focusing on the healing of skin lesions, which is predominantly superficial problems, but let's not forget that we have to treat effectively the source of it, the actual nerve ganglion, and then following the distribution, nerve distribution, the pathway. So that is why here I have included 3 steps 3 placements for treatment arrays. Red light 50-50, infrared frequency 10, duty cycle 60%. So 555, 666 on the infrared. And with the laser probe, 8 minutes in duration for both of them. This is when, again, we have to remember when treating the actual origin of that segmental nerve, the nerve ganglion, foraminal opening, we would have to spend a little bit more time on the laser probe application. This would be somewhere between 5 to 6, even to 8 seconds per spot application, and then to a lesser degree, less in duration, 2-3 over those skin lesions. Stage 2 level intensity. Red light continuous wave, infrared 50-50, and with laser probes, red laser probe at full power 100%, and infrared with continuous wave 80% power. Also, I'd like to mention that in these particular cases involving pain, such as shingles, red laser probe actually is helping us to achieve our pain relieving efforts. And so it plays a dual role, helping us to speed up the healing, but also reducing the pain. Stage 3 intensity, red light 250-90, infrared light 250-80, and both laser probes at full power, 100%. So once again, this would be the stage when all of the acute inflammation vesicles would be totally under control, and we are not kind of risking to aggravate any additional discomfort or pain. That is why this is the intensity level that will help us to get to the finish line. Verruca vulgaris, or warts, also, even though we see some ugly looking skin lesions, but at the root of the problem is the virus, a keratotic papilloma of the epidermis. It occurs most frequently in young individuals as a result of localized infection by variations of the human papilloma, usually type 2 and 4. Lesions variable in duration, eventually undergoing spontaneous regression. So they can be exophytic, okay, lesions that grow outward, and endophytic, those lesions that grow inward from epithelial surface, with hyperkeratosis, parakeratosis, hypergranulosis, and papilloma formation. 76-year-old man who was coming to the laser clinic for primarily his low back treatments due to chronic low back pain, degenerative disc disease, and then central canal stenosis. So one day he says, "Slava, can laser help me with this?" And I took a closer look and I took a picture immediately. So this is a wart, definitely, the type of papilloma. And he said, "It's just bugging me because I'm a right-handed person and I'm using my right hand for whatever activities I have to do at home. And it would be just cracking and bleeding, causing pain. Sometimes even infection gets in. So it's really annoying. I need your help." And what I was doing, every time he would come for laser treatment for his back, pro bono, just with the laser probe, I would give him some touch-ups, 2 or 3 minutes maybe. And after 16 in total laser treatments, just with the probe only, you can see it has cleared completely beautifully. Now, this was a different kind of scenario. A 25-year-old female. It's interesting. I remember when she came, she was a personal trainer, an athlete. She came and she said, "Well, I'm engaged and we're planning a wedding, and I would like to get rid of my plantar warts before the wedding day so that I would look perfect. And another thing is, they're so uncomfortable, they're so painful that wearing high heels for me would be quite challenging. Can you help me with this?" And to be honest, at the time, I haven't seen plantar warts of this size and chronic in nature. And I thought, well, definitely we're going to try and hopefully we can do something before your wedding day. And in fact, she responded very well. It took us only 10 treatments. So we had to cover the entire surface area of both of her feet. And she did well with laser treatments. Heel area, so we can see what was happening there. Definitely, those lesions, those warts, they've been sitting there for not months, but years. And you see this beautiful transformation on the inside and outside. 26-year-old man, okay. If I wouldn't see this with my own eyes in front of me, I wouldn't believe that this could be even possible to have warts like this. But in fact, this patient came to the laser clinic on dermatologist's recommendation. That was another surprise to us. We've been contacted by dermatologists from U of T, from St. Michael's Hospital. So a little bit of prehistory. This man underwent a double lung transplant surgery and was receiving immunosuppressive therapy and has developed quite a few complications and was already receiving lots and lots of all kinds of medications. So they told us he needs to be physically active, to do a lot of walking, exercising, to maintain his lungs active, lung capacity, breathing, cardio exercises, but he cannot even walk on his feet. So these warts have become so painful, so aggressive, that putting him on more aggressive antiviral medications would really, really compromise his immune system. And they've been looking for some other non-invasive, safe options for him, but effective. And laser therapy is the one, as we all know now. So after 13 laser treatments, I was able to take this picture, and it was a noticeable and significant improvement. Then he has had a few more treatments and felt so good that he ran away from us. I wasn't able to get him for the final photo shooting session. Treatments for those lesions: red light continuous wave, 2 placements, because if you're treating the wide surface area, you would need 2 placements, obviously, to have full coverage. 6 and 6, infrared 20/70, 6 and 6, again using both laser probes for many reasons, to achieve a tissue repair, regeneration, but also to have that pain relieving effect when treating patients suffering from pain. Stage 2 intensity: red light 190, infrared 30/80, duration stays the same, and increasing the power output on laser probes. Stage 3 level: on the red light 1090, infrared 250/80. Now on the laser probe 200, infrared frequency 100 duty cycle 80. The red laser probe stays the same at continuous wave. Acne. Acne vulgaris involves the inflammation of the sebaceous units, causing purulent type lesions normally distributed on the face, but also it can be widespread on other body parts like neck, back, chest, forearms. So again, only because, like I said, previous speakers did a very good job getting into details. I'm just going to go to the case immediately. So this 22-year-old female with a history of acne since her puberty, she said it's not just those fresh lesions would be appearing and bothering her, but also some previously pre-existing scarring that will be somewhat troubling her. And that is why the combination of red and infrared wavelengths can effectively address both of those issues. So you can see how the inflammation was reduced initially. It took us initial 3 treatments, and then we've continued working on skin rejuvenation and skin remodeling. So this will help us to achieve the best possible effect in kind of undoing the damage previously done by previous flare-ups episodes in the past. And so this is the 22-year-old, but look at this patient who was much older, and she was having problem with her acne for more than 25 years. Again, she said, even though I'm not already a teenager anymore, and my hormones should be by now stabilized, but there is a lot of pre-existing skin damage due to previous episodes and a lot of scar tissue formation. Can laser undo some of that damage? The short answer was yes, but obviously it takes time. So initially, first 2 treatments, again, would help us to cease to control inflammation, to work on those most recent lesions, but then extending into more treatments working specifically on those residual scarring, those kind of skin craters on the surface of the skin, would change the entire situation in the facial region. Parameters. Red light 50-50, infrared 10-30. Again, durations very short, 5 minutes replacement on the red, 6 minutes for the infrared. Laser probes, both of them. Again, like I mentioned earlier, initially we're working on acute inflammation, erythema, and then stage 2, modulating, switching from the continuous wave on the red light to frequency 100. And then again, incrementally increasing from 60 to 70 to 80 to 90% on the infrared light. I'm giving you the range for frequency and for duty cycle. So beginning with 20 hertz, and then incrementally going to 30, 40, 50, and duty cycle from 50 to 60 to 70 to 80. Also increasing gradually the power output on laser probes. And stage 3 intensity, red light 1000, duty cycle 90, infrared 250 and 80, and both laser probes at full power. So once again, these are the intensity parameters we're using when inflammation is not in the picture anymore, and our main focus will be on skin remodeling, rejuvenation, collagen formation, working on all of those scarred elements. In conclusion, dermal lesions superficially located, as may be expected, are highly sensitive to light therapy, in a good way sensitive. And response to phototherapy in most instances had been noted to be both rapid and dramatic. In our experience, there were no negative side effects reported to date. With all dermatological lesions, systemic illness should be considered and treated if present. And I always invite other healthcare practitioners, first of all, patients themselves, to address those issues. No matter how extensive lesions and with the provision of the etiological factors have been removed or under control, recurrence does not appear to be a fact. Indeed, once you reintroduce patients to a healthy lifestyle, diet, supplementation, and once they know that laser therapy is available as an instrumental healing modality, this can be well maintained and cared for the rest of their lives. We highly recommend the incorporation of laser therapy in dermatological practice by all practitioners who treat these conditions. And this concludes my presentation. Thank you very much.
Okay, so we're going to finish off the day. Again, we're going to go over time. So just to let you know that, it should take about half an hour to finish up. And I'm going to talk about specifically hair loss, scar tissue healing, and some comments and a bit of information about weight loss that maybe many of you have heard about with photobiomodulation. So let's get into hair growth. Obviously, hair is a very fast-growing tissue, and it undergoes fairly repetitive regenerative cyclical changes in different stages. Anagen, 80 to 85% of head hair is in this stage. This is the active growth stage, usually several years to 6 years in length. Then catagen, which is involution, kind of shrinking up, that occurs over a couple of weeks, allows the hair follicle to essentially start to renew itself. And then telogen stage, which is a resting or dormant phase, about a month or 5 to 6 weeks. And at any given time, up to 20% of the hair is in this resting or dormant phase. So you can just sort of see what the pictures look like with respect to the growth phase, and then it starts to involute, telogen stage, where you start to get some reformation, and then anagen stage along that pathway. So when it comes to alopecia or hair loss, there's different types. The one that's most common, of course, we know of it as androgenetic alopecia or AGA. So that can affect up to 50% of the male population, and it's thought to be triggered by testosterone, which is converted to a hormone DHT, while DHT is essential for regular hair growth, but in the scalp, large amounts of it is actually detrimental to hair follicle growth. So what happens is this hormone bonds to receptors in the hair follicles, and it triggers their deterioration. the overall process of this is still not overly clearly understood. And of course, there's different patterns, and it's basically based on hereditary and genetics. If you go back and look at each person's father and grandfather and so forth. So essentially this DHT, you can sort of see it here accumulating on the base of the hair root and the follicle. Then you can see it starts to detach and kind of involute. You can see the capillary starting to be sort of pulled away almost. And eventually, because that, as it shrinks and involutes, the blood flow directly to the hair follicles decrease as well. And this starts the hair to sort of die. And just your understanding now of photobiomodulation, obviously, is you know that we can use photobiomodulation to improve capillary growth. So that's one of the ways, potential ways that photobiomodulation can help. It doesn't stop it completely, but it can be very helpful. And I'll show you some of the research and some approaches for that as well. Then there's other types of alopecia that you should all be aware of, because even though, male pattern baldness is the one that, you tend to hear more about, there's other ones that are very common and very treatable as well. Alopecia areata, or spot baldness. This is more of an autoimmune inflammatory condition, up to 2% of the population. It doesn't tend to be all over the scalp. It's usually in very distinct areas. Each size is maybe the size of a quarter, a loonie, that kind of thing, and it tends to slowly grow back. Overall, the underlying mechanism is thought to be immune mediated. Kind of, if you think about like rheumatoid arthritis, that kind of thing, where the body senses the hair follicle as being foreign and it actually attacks it, you might say. It can be linked again to hereditary issues. Here you can see pictures of what it sort of looks like. It's also associated with people that have asthma, hay fever, atopic dermatitis, thyroid issues, vitiligo, Down syndrome, and a specific drug for cancer called nivolum. I don't know how you say that drug. Usually docs prescribe corticosteroids for this condition. Another type of hair loss is anagen effluvium. It is a diffuse type of hair loss, and this is usually associated with a chemotherapeutic agent. This is what we tend to see with patients undergoing chemotherapy or even radiation therapy post-cancer, and up to 65% or more of patients undergoing chemo will have this type of hair loss. So again, photobiomodulation would be very helpful in restoring the hair back to its normal growth cycle. Entelogen effluvium is a form of hair loss due to stress, which causes the hair roots to be pushed prematurely into a resting state. It can be acute or chronic. There's usually some kind of shock. It could be anything from a bad car accident, witness something traumatic, that kind of thing. And that stress and the body's reaction to it can actually cause this type of hair loss. So it also can be associated with childbirth, severe infections, even chronic illnesses. I mentioned about psychological stress and even major surgeries or illnesses. Even some medications are known to trigger it: retinoids, beta blockers, calcium channel blockers, even something as benign as ibuprofen has been linked to this type of hair loss as well. So it's really important that if you're thinking about treating these patients, you really understand what's going on and maybe the underlying etiology as well. Tinea capitis, again, you might come across this as well. It's sometimes called ringworm. It's a fungal infection, however, not a parasitic infection. And this is essentially, infection can penetrate down into the hair follicle's outer root sheath and ultimately damage the hair shaft. It can be either inflammatory, where it's obvious it's red and inflamed, or a non-inflammatory state. Usually you'll see it more in hot or warm climates or during the warm months of the year. It tends to be more common in children and immunosuppressed as well. So photobiomodulation and hair loss. It all started with this fella, Andre Mester, who actually kind of serendipitously discovered photobiomodulation or laser therapy back in the 1960s. Those of you who have taken the training that we offer or have read a bit about photobiomodulation know the origin of how we came to understand that lasers and or lights can stimulate the growth of cells. So of course, what happened was with Andre, he was trying to treat some rats for cancer, and the laser he was using was very underpowered, and the net result was that the hair grew back faster than the control in the rat. So that got him thinking that it somehow had an effect on the metabolism. And that's really one of the first observations of laser therapy, and why nowadays laser therapy photobiomodulation is used quite routinely in helping hair to grow. So it's thought that photobiomodulation can stimulate follicular stem cell proliferation and differentiation by increasing levels of heat shock proteins, which influence the regulation of cell growth and differentiation. That's a handful, right? So essentially, it can help the re-entry of telogen hair follicle into the anagen stage. It can bring greater rates of proliferation during the growth phase. It can prevent development of premature catagen stage, and can even extend the duration of anagen phase. And of course, it can decrease inflammation. One of the common drugs that's used, everyone's probably aware of it, is minoxidil. The reason why I'm going to mention this is that there's a paper that compares minoxidil to laser therapy. So it's a commonly used drug. The mechanism isn't clearly understood, but they think it has to do with nitric oxide. And again, those of you who are familiar with photobiomodulation know that one of the byproducts of ATP production, reactive oxygen species, but also the release of nitric oxide when photobiomodulation strikes the cytochrome C oxidase, and that can freely diffuse into extracellular space. And therefore, it kind of makes sense that photobiomodulation might work in a similar mechanism as well to minoxidil. And also, of course, inflammatory processes, reduction or immunomodulating the immune response as well, can all have a positive effect, right? But a lot of it has to do with reduction of inflammation. And it has been widely used for alopecia areata as well. Some research on this, there's quite a bit actually. This particular one was published in the Dermatology Journal. At that time, they called it a novel approach. That was 4 years ago, specifically in alopecia in females. They looked at 44 healthy female volunteers aged 18 to 60, and they had certain types. They categorized them of hair loss. The sites were trimmed to a maximum of height of 3 millimeters in an area that was approximately 2.5 centimeters in diameter. They used very low power lasers in the red. So these low power lasers are almost equivalent of high powered LEDs, by the way. And you can see here they treated every other day, so about 3 times a week for 17 weeks. So pay note of the tension that treatment times or treatment plan for hair loss does take quite a while. And you can see some of the results here, the before and afters, especially in the bottom picture. You can see that there's a lot more density of hair, but even specifically, if you look carefully, you can see the hairs are thicker as well. So the study demonstrated that at 660 or 650 nanometers, that it actually caused significant improvement in the female patients who used this light device. Another paper in 2013 using visible red lasers and LEDs. This one was in males, again using very low powered lasers and LEDs. And again, treating every other day. It was a home device that they used for 16 weeks, 60 treatments. So again, quite a long treatment plan. And you can see here that some folks also had placebo treatment as well. And the hair counts were 140 at baseline and 280 at 16 weeks. So quite a significant improvement. And again, if you look carefully, you can see the thickness and the health of the hair follicles were better in the treated patients. This paper was again looking at both male and female pattern hair loss in a multi-centered randomized sham device controlled study. So quite a few numbers of subjects here using red light. and 3 times a week for 26 weeks. So you're seeing the pattern now. Minimally 3 times a week is what would be recommended. And I'll talk about protocols coming up shortly. And then you can see the results, the before and after over that time frame. You can see a fairly significant hair growth occurring. So what's happening there is you're getting the hairs that were stuck in the not growing phase into growing, and then the hair follicles themselves and the hair cells growing, having more blood supply and therefore being thicker as well. So they detected a statistically significant increase in the terminal hair density after 26 weeks, that there was improvement independent whether it's male or female, and that there was an increase in terminal hair count that was comparable to the short-term trials of the minoxidil topical solution, but less effective than longer-term trials. So in other words, you do have to keep up the treatment over a period of time. Now, as far as using BioFlex, what I'm going to recommend is that you use the dual red 660 nanometers. You don't have to really use the the infrared. So anywhere from 10 to 15 minutes in duration before you move it to the next location at a continuous wave. If you do have a red laser probe, you can use that as well. You can use it at 100%, only holding it for a few seconds per point to cover the area in conjunction with the array. So I would set the array at maybe 10 minutes and then the infrared probe. If you don't have the infrared probe, or that red probe, sorry, if you don't have the red probe, then you can increase to maybe 15 minutes or so of just the array, okay? So again, you may have to alter the treatment time. If the scalp color or the hair is quite dark, you may need to slightly increase the time because of the absorption of some of the light by the hair. I also suggest that when you're placing the array on the scalp, that depending on the thickness of the hair, most people aren't willing to cut their hair, so gently move it back and forth so that the hair follicles move side to side so that the diodes make better contact with the scalp itself. Okay, and you want to treat not just the obvious thinning areas, you also want to treat where you think there's also some thinning or potentially that can happen. So you need to look back, you need to figure out the pattern if you're treating male pattern baldness, if there's a genetic component to it. So looking back, they can track their history, or if you're just treating other specific areas, you can just treat around those areas as well. Okay, let's talk a little bit about scar tissue healing, and specifically I'm going to talk about keloids and hypertrophic scars. You know, when there's an injury, that kind of insult to the tissue, we normally have normal wound healing, of course. In fetuses, actually, if they get an injury or something like that, which is of course rare, but they've observed that if it happens, there's no scars. But as we grow older, then what happens is our skin starts to produce and react to the trauma, and it ends up in the actual scar itself. So hypertrophic scars and keloid scars are benign fibrotic skin lesions. Again, usually post-surgery, post-trauma, that kind of thing. And it really has to do with fibroblastic proliferation, basically kind of out of control, not like cancer out of control, but excessive collagen deposition. That's the main characteristic of these lesions. Two types, hypertrophic and keloid. This is an example of a hypertrophic. It tends not to be larger than the wound itself. It's slightly raised, red, thick, is usually over an area where there's excessive tension on that skin. And the scar tends to flatten out over a period of time, becomes a little more pale and flatter. So again, it does not tend to extend over the actual initial of the area of that initial injury. Whereas a keloid scar is looks obviously quite a bit different. It's pinkish, purplish, sometimes even flesh colored. It's quite hard, firm mass. It tends to extend over and around the injured area itself. It can either form immediately or slowly over a few weeks or months after the actual injury itself. It can also be associated with itchiness, soreness, or discomfort in that area as well. More commonly, keloids are found in the upper chest, shoulders, and earlobes, but it can occur on any part of the body. It also seems because of genetic reasons that darker skinned individuals are more susceptible to keloid formation. So this is not a harmful condition per se, doesn't turn into cancer, but for a lot of people, it's a cosmetic kind of thing that they'd rather minimize if possible. Sometimes they do surgery, and oftentimes that leads to it just growing back or getting worse. So it's not usually the best approach for treatment. So there's basically imbalances going on of the collagen biosynthesis. And this, of course, is genetic differences as well and predisposition. These are all potentially some of the pathogenesis of why some people get these scars and other people don't. And there's lots of potential reasons for that. I won't get into all these different interleukins and growth factors. I'm sure you had enough of that over, over the course of today. But essentially, if you sort of want to delve into that, feel free to examine this diagram in detail. But given the time crunch that I'm on right now, and probably most of you are just wanting to get up and run around for a bit, so I'll get through that one. And understanding that it really comes down to inflammatory mediators as well as certain growth factors and interleukins that really are responsible. There's some research on this. This particular paper was looking at hypertrophic scars and keloid. A few patients were looked at. So these are just case studies. And they were using a home device, near infrared. And again, near infrared was used because it can penetrate deeper into the epidermis and around the area, although I'm still going to recommend red and near infrared. So you can see some examples here of the keloid, the controls on the right, and then after treated as well, you can see significant improvement post-treatment. So let's start at the top right. Here's a control, no treatment, and then the baseline infrared treatment, and then you can see the progression of the improvement of the keloid formation. Okay, don't mean to be rushing here. It's just I got so much information to get through, and you guys have been very patient with me. We do have a few case studies that Dr. Khan has done over the years. Again, apologies for the photographs here. These are quite old from the archives, but you can see this patient had some scars on the face. I won't get into the reasons why, but there were scars here. And you can see 13 treatments after 2 months. If you look especially around the upper lip region, and you can also, if you look carefully along the cheek, those scars have basically almost disappeared. So it does go to show you these were chronic scars that she initially presented with. So even chronic scars can be helped to varying degrees. Again, if you look carefully here, you can see some lacerations and scars, sorry, not lacerations, but scars between the breast on the sternum and that lower abdominal region. And again, hard to see, I know, but if you do look carefully, you can see that the scarring has remarkably reduced. This was about 15 sessions over a period of 3 months on both over the sternum and in the abdominal region. These were all case studies done by Dr. Khan. This is a really great example of a keloid and how it can help a keloid. So you can see here on the back of the calf, it's still kind of reddish and raised. And you can see here fairly rapid. I mean, that's very quick. I would say that's a really dramatic result. Not necessarily expecting that all the time, but Dr. Khan was able to achieve that in 3 to 4 sessions over several weeks. It says, I think it says 12 treatments over 2 weeks. That should be 3 weeks, by the way. My apologies. And then another one here after 5 sessions. The patient still had more sessions, but you can see the keloid scar, the initial presentation, and after 5 sessions, you can see that keloid scar reducing in volume. So of course it's not resolved, but it's improving. And of course, more treatment would have continued on there. Protocol-wise, again, we're going to stick to the dermatological protocol. That one I mentioned earlier for 12 minutes of red, and then for infrared, you're going to use, again, the 12 minutes 50-50. And however, in this case, I will recommend the use of the infrared probe because you want to get that light as deep as possible as well. I'm going to suggest you lower the power of the infrared probe to around 30% or so. 6 minutes is generic. It depends on how long you need it for. I would hold the probe for 5, 6, 7 seconds before moving to the next point. You can repeat a few spots and go around the scar as well. And again, once you get up to stage 2, you can start to see similarly that I've showed you earlier in dermatological protocol, starting to pulse out the light in the red and lowering the duty cycle slightly. And then for the infrared, increasing the duty cycle and keeping the 12 minutes. And same thing, no changes in the infrared probe. Again, always use, especially if you're treating around the face, I'm always going to mention to make sure the patient wears those goggles and to protect against any pulsing of light as well. And especially to always take pictures with their consent, make sure everything's blocked out so that you can properly monitor. There's software out there that can actually measure in 3-dimensional and 2-dimensional areas of the wounds that you're treating or the scars to really have an idea of how well your treatment's coming along. As far as the treatment plan goes, I've mentioned this now a few times, you're going to treat 3 times a week. Be prepared for a longer treatment plan, depending, right? 4 weeks, 5 weeks, up to a couple months, maybe even longer. It really does depend on the extent of the scarring as well, right? You should also make sure that you have realistic expectations as well. Okay, last thing today before we finish our day is about weight loss and specifically how photobiomodulation might be able to help with that. So the mechanism is not really understood. I'll show you some pictures. They think there might be some transitory pore formation in lipocytes that essentially cause it to leak out lipids or fat, which gets absorbed in the bloodstream and disposed of. But there also may be a systemic effect as well too. This may play around with oxidative stress and other mechanisms, again, not clearly understood. This is just a diagram kind of showing you where the light enters a lipocyte and penetrates through the cell membrane and creates the ATP production, nitric oxide release, ROS. We're all pretty familiar with that. And it seems to somehow cause these micropores, perhaps, that lead to lipolysis. And you can see that lower left-hand portion representing that. This is a scanning surface electron microscope kind of showing those pores in the cell membrane. I looked at the research. This paper does a summary of them. I won't go into detail about each of them. Some were negative, some were positive, and some are biased. So we need to understand that it's not all positive, and you have to really read through some of the, how should I say this, these biases to really get an understanding if this is something that in fact may really be helpful for people wanting to lose weight. This was an overview of the papers that were out there, and they basically say that there is a potential that can be used for fat. They mentioned cellulite, but I don't think so for cellulite. At least the research doesn't really show that much with respect to cellulite. And again, they're mentioning this mechanism about the lipid kind of leaking out to some degree, or some kind of cascade of events systemically as well. That might be one way that it can be helpful. So they're saying, yeah, it could probably be helpful, but not necessarily as a standalone treatment, which makes a lot of sense, right? This paper looked at not just laser therapy, but other non-invasive body contouring devices out there with respect to reducing subcutaneous fat and cellulite. So they looked at things like radio frequency, high intensity ultrasound, cryolipolysis, shockwave therapy. I don't know what WBF, WBB is, I forget what that one is, and laser therapy. And so long story short is that they did feel that some of these non-invasive body contouring devices did show statistical significant effects, including laser therapy. So there might be something to this, right? But the effects were not significant, like not major. They were mild to moderate side. So they were saying on average, 2 to 4 centimeters reduction in circumference, for example, of subcutaneous fat during the total treatment session. So basically they're saying there's not a definitive non-invasive treatment method for weight loss, but it should be helpful, and they didn't really seem to find it helpful for cellulite, okay? And they're still trying to understand the parameters, that kind of thing. So this early research is suggesting that it could be helpful, but I'm going to suggest a few things here is that you have to understand that some of these things were done not quite in standard reproducible methods and placebo randomized control just for laser therapy. So it's hard to know what laser therapy is doing, what some of the other interventions are working as well. A lot of them use red light, and that's because one of the manufacturers, who I will not name, just uses red light. And it doesn't make a lot of sense if you want to get deeper into the subcutaneous area. So it makes sense to me that you'd want to use both if you're going to try and do subcutaneous fat loss. That would make most sense to me. And of course, you're going to want to combine it with other known ways of helping people deal with losing weight on a long-term basis, and that's nutrition, counseling in general, lifestyle measures. You know the drill. I won't go into all of that. If you're going to use our equipment, then I'm going to suggest you do use both the red and the infrared arrays, not just the red. And this should facilitate both that indirect and direct effect on the lipocytes or the fat cells. So again, make sure that these patients are being treated frequently enough. This is where having home-based treatments really more recommended, only because they can treat 3, 4, 5, 6 times a week relatively easily, and it gives you more consistent results as well. Minimally in the clinic 3 times a week. So there aren't specific protocols that have been established yet, and the research is still a little sketchy as far as understanding that. But based on all that, I know people want to try it, and that's fine, as long as you understand that we're still not quite sure exactly what it's doing. It's not harmful, but you need it to use in combination with other treatments. I'm going to recommend red, continuous wave, 8 to 10 minutes duration, and you're going to do several placements to cover all of the subcutaneous fatty area that you're trying to treat, along with infrared, pulse at 50-50. That seems to be a really good stimulatory effect. With that pulse rate, Dr. Khan has really had great effects with the 50 hertz on skin in general. And again, another 8 to 10 minutes in duration. So you're looking at 16 to 20 minutes duration over one area before you move into the next area.